Good morning. My name is Dr. Sunny Anand, and I'm a professor at Stanford University. And it is my great pleasure to welcome all of you to the 6th annual Ideal Village Conference. This has been a tremendous journey, and I would like to share my slides to show you where we've been and where we will be headed. So, the theme of this conference today is post-pandemic normal, the path forward. Just a word about the theme is the fact that this COVID-19 pandemic has touched every life on this planet. Things are changed, the world is changed forever. And it is unlikely that we will be able to come out of this unless we engage in collective action in order to overcome the various challenges facing the world today. So for those who may be unfamiliar with this term, what are ideal villages? Ideal villages are those that meet the essential needs of the village community in healthcare, education, energy, livelihoods, water and sanitation through affordable, effective, equitable, and empowering solutions, involving all stakeholders from the local community and ensuring eco-sustainability and self-reliance. So this is an opportunity for corporations, foundations, investors, academics to collaborate and develop sustainable efforts for uplifting rural or underserved communities. We have had a significant journey with the first Ideal Village Conference in 2016 at Stanford, focused on innovations for the ideal village. The next one was collaborations for the ideal village. And the third one in 2018 was empowerment of women. The fourth conference focused on corporate social responsibility for rural development and underserved areas. And last year, we focused on sustainability and the pandemic. This year, we have an array of very distinguished speakers and thought leaders in the world from multiple different disciplines who will talk about the post-pandemic normal and how we move forward from this. We've had more than 1,500 participants from 30 plus countries participate in these conferences, with over 70 companies, nonprofits, universities, foundations, etc. We have several partner organizations and sponsors, and I would like to recognize those, being the Wheels Global Foundation, the African Asian Rural Development Organization, the Tata Consultancy Services, and our partners in India Sport, IEEE, and IEEE Smart Villages as well. Our vision is to move forward with these conferences and develop an ideal village think tank or a rural development think tank and center of excellence at Stanford. Our sessions will cover today healthcare, education, water, and sanitation. Tomorrow, we will cover societal issues, sustainable livelihoods, energy, and environment. Our anticipated outcomes are that we will use the lessons learned from the pandemic to develop innovative solutions for healthcare delivery, bring educational equity and models for vocational experiential learning, scale technology-enabled solutions for water supplies and waste management, and have practical approaches for greater economic stability and rural underserved populations, including energy and pandemic-related opportunities for restoring inner peace, societal harmony, and human values. This is just an overview of today's program. We will continue this until about 12 o'clock Pacific time, and this is the overview of the program for tomorrow. So before we get started, I just want to mention a few housekeeping issues. In so much that audio and video will be disabled for all attendees, except for the invited speakers and panelists for each session. Please use the Zoom Q&A tab at the bottom of your screen in order to type your questions. and the chat box to share your comments, thoughts, and feedback. Only the Zoom registered participant will have access to the Q&A. It's not available on Facebook Live or YouTube live streaming. With that, I would like to stop sharing my slides and introduce the co-chair for this conference, Dr. Sundar Kamath. Dr. Kamath is Senior VP at Sanmina Corporation and has been the person who originated the Ideal Village concept and has been leading this charge collaboratively for the last 6 years. So over to you, Dr. Kamath.
We can go to my slides. Good morning, everyone. It's a great pleasure to be here. And also good afternoon, good evening to our global audience. Thank you for joining us. And we have a pretty tight schedule, so I'm going to be moving fairly quickly through my content. As past participants in this conference are very familiar with what we do, the Ideal Village, I will not spend a whole lot of time. The concept has been discussed by Dr. Sani. Let's go to the next slide. So the key elements of the Ideal Village are really three important pieces. One is collaboration, second one is holistic solutions, and the third is sustainability. This is the bedrock of the Ideal Village concept. And the point that the fundamental point of the Ideal Village is that we are trying to enable essential needs for the rural economy, since it's such a vast population that does not even have the basic needs. So when you say collaboration, it's between all the stakeholders in the village, the foundations, the corporate CSR programs, and those who are taking part in the program. On the holistic side, we have to look at every aspect of the village improvement, whether it's water, healthcare, education, so on. And then finally, sustainability is extremely important. We've seen what happens when we don't pay attention to the climate or the environment. So that's the basis. And when I say collaboration, this is an example for the last 5 years, when you look at the different areas like healthcare, education, CSR, energy, and livelihoods, we've had a phenomenal set of organizations participate. And so there's potentially 60 plus organizations for collaboration. And that's very important. So in my talk today, I'd like to share some more about this collaboration in these several specific areas: rural healthcare, nutrition, maternal and infant health, congenital heart defects, startup innovation, technology plays a role, rural education, livelihoods, and of course, corporate social responsibility. So I'm going to quickly go through some examples of this model of collaboration, which is what we want to grow further with this year's conference and the organization they're working with. So for example, in India, we work with the Shri Sai Healing Trust in Chennai on the healthcare aspects for the Ideal Village. This organization has been functioning for a very long time, and there's a program currently which covers 4 states, as you can see from the map here, clusters of villages in these states, coming to about 400 villages. And the organization covers healthcare, screening, in conformance with national standards, and works at the ground at the ground level. So if you look at 6 of the examples of these villages, which are in Karnataka, Maharashtra, and Tamil Nadu, we have CSR partners. The population ranges from 500 to about 5,000. Typical occupations in these villages could be farming, daily labor, cattle rearing as well. And we know the number of houses and families in these villages, and how far is the nearest primary health care center. So here's an example of this village, Chandapura, which has pretty much, I would say, reached 80% of our criteria for an ideal village. Health screening of residents and school children, classrooms have been improved, playgrounds, they get classes after school, drinking water, solar power for lighting, safety of electrical appliances in the houses, waste collection, eliminating of open drains for better hygiene, planting of saplings and taking care of the greenery. And they have a local temple which is being maintained, and there's CSR support for this from the Sheraton and Marriott. Now, this program now for the state of Tamil Nadu, the plan is to have ideal villages in every district of the 38 districts. And so this is being discussed with the government by this organization. Another organization that we work with focuses on maternal and child health programs. These were launched about 4 years ago, 3 to 4 years ago, and we've covered 115,000 children have been screened in 2,000 schools and Anganwadis. 40,000 mothers have been screened, both in terms of antenatal care, nutrition services for rural pregnant mothers, women. And on the education front, the focus is again on rural campuses. So this is an example of Karnataka, where values-based education campuses are being constructed in every district of Karnataka to impart high-quality education free of cost to the rural children, both boys and girls. Another important partner that we have is the Annapurna Breakfast Program, which started about 7 years ago with a small group of IT professionals supporting local schools. The issue was that school children, the rural school children who go to government schools, really have no resources for food in the morning, because the parents typically tend to be working in the fields or laborers, and the children go to school and wait for the midday meal. This has a tremendous impact on their cognitive ability. So this group started this work, and today, amazingly, in 7 years, they're covering 500,000 children across the country in India, across 6,000 schools, 17 states. And it's been a tremendous success story. This has also evolved into a micronutrient protein powder. It's not always possible to provide breakfast. So the Karnataka state government provides free milk. So this powder is mixed with the milk and given to the school children in the morning, and it has seen tremendous benefits. There's a very strong corporate support behind this. On the right side, you can see the companies that are supporting this program. And this is a wonderful story of how a small group, dedicated group, focused on a good intent and a very noble intent, which has impacted school children, just like Akshay Patra does for the midday meal. Similarly, talking about CSR, this is Sanmina in India, for example, in Chennai, has a mobile clinic which goes to the villages around the plant as part of India's corporate CSR programs. It benefits over 50,000 benefits across 50 villages, 35,000 patients, and hypertension and diabetic patients have been taken care of as well, including eye, ENT, and dental exams. We have a partner in the US as well, where we have focused on underserved regions. We're starting in Mississippi Delta, where we've set up the company called People Shores, which will be discussed tomorrow's livelihood session, have trained local youth and in IT and created jobs. Finally, I want to cover this very important program, which is focused on congenital heart defects. India has the highest incidence of congenital heart defects, and almost 250 children die each and every day. So these hospitals were set up by the Heart Foundation and the Sri Sathya Sai Sanjeevani hospitals in Chhattisgarh, Maharashtra, Palwan. And to date, children from 28 states in India, 17 countries have been examined. 16,000 surgeries have been performed to save these children, and 243,000 lives have been touched. Another amazing selfless service program that affects lives. And when I said innovation and technology, this is an example where a company called HD Medical, a startup, invented a digital stethoscope with ECG. And this is being used now to screen the children in the villages. So 75,000 children have been screened, and the program is very successfully implemented by trained volunteers in the villages. Finally, here's an example in Calcutta of the Satya Sai Arogya Vahini, which has mobilized people to support during the COVID-19 relief plan. And this is an example of taking healthcare to the rural areas. 500,000 people have received access. So all of these are examples of partnering, collaboration that we want to further grow. I'm going to end my talk with the video. I'm going to ask if you can please play the Arogya video.
Thank you, Dr. Kamath. That was an excellent presentation. It is now my great honor and privilege to introduce the inaugural keynote speaker for this conference, Dr. Catharina Boehme. Dr. Catharina is chef de cabinet at the World Health Organization. She took up this position in March of this year, and she was previously for 8 years the CEO of FIND, which is an international alliance for diagnostics, and reached more than 100 million people. Dr. Boehme is a trained medical doctor with diplomas in public health and management, and she has done extensive field work in Ghana and Tanzania. So I would like to welcome our inaugural keynote speaker, Dr. Boehme.
Thank you so much, Professor Anand, and I hope you can hear me well. Warm greetings to all health leaders, colleagues, and participants, and many congratulations on holding the 6th annual Ideal Village Conference at Stanford University. I'm very pleased to have this opportunity to reinforce the World Health Organization's links and partnership with Stanford University Medical School, with Science for Society, with my co-participants, and with the Ideal Village concept as a whole. As the concept underlines, only by working together in a holistic, integrated, and collaborative manner will we find the way forward. This year's conference is on one of the most important subjects possible as we emerge from the global COVID-19 crisis. Post-pandemic normal, the path forward. Put in the plainest language, what is the world to do next? You don't need me to tell you that the scale of the pandemic is enormous and that it has affected all sectors of society and all corners of the globe. As of today, there were almost 230 million confirmed cases of COVID-19. The global death toll from the disease stood at well over 5.5 million. On a more positive note, around 5.7 billion vaccine doses have been administered. The global economic cost of the pandemic has to be stated in figures with so many zeros as to be almost incomprehensible, but an estimated 4.3% shrinkage of the global economy in 2020 to 2021, which would mean a global cost of more than 10 trillion US dollars. And this disastrous pandemic reveals one thing with brilliant clarity: the interconnectivity between health issues and all aspects of society, all aspects of our living, learning, and working together on this planet. It has revealed the importance of the holistic approach at the heart of the Ideal Village program. The pandemic has also shone a light on the increasing divide between the wealthy and the poor. For sure, the global vaccination rate is encouraging, but the fact is that almost 80% of vaccines have been administered to those living in high and upper middle income countries. If you live in a village in Africa today, you have a very scanty chance of getting vaccinated. Of the 5.7 billion doses of vaccines administered, only 2% have been administered in Africa, while 66% of people in high-income countries have received at least one shot of COVID-19 vaccines. That could be thought of as bad medicine, because in the case of this virus, no one is safe until everyone is safe. The fact that the virus is free to circulate uninhibitedly in certain parts of the world gives it every chance to mutate, possibly even to a more dangerous form than the Delta variant, or, who knows, into a form that will evade our current vaccines. That would put us back at step one again. Together with the heads of the International Monetary Fund, the World Bank, and the World Trade Organization, the World Health Organization has called for a massive global push to vaccinate at least 10% of the population of every country by end of this month, at least 40% by the end of this year, and 70% coverage by mid next year. So far, we are failing to meet those targets. However, while highlighting glaring global inequality, it is also true that the COVID-19 pandemic has brought about many positive developments and given us instances of real global solidarity. Some quick examples that come to mind. In just over a year, innovation-based global collaboration has led to reliable tests, treatments, and safe and effective vaccines, though access to these tools remains a major barrier. This is truly a record when you consider that 3 decades of attempts to create an HIV vaccine have proved fruitless. I'm also thinking about how a laboratory in China, within days of the declaration of the outbreak in the early 2020, had completed the genomic sequencing of the virus. On 12th January 2020, China shared the sequencing with the rest of the world, making surveillance, early detection, and tracking the spread of disease much, much easier. Medical oxygen shortages around the world have been tragic features of this pandemic, affecting poorer countries disproportionately. But unprecedented cooperation with the private sector, with medical oxygen engineering companies, is making it possible to find a way out of that situation. Yet, many challenges remain. So what are the lessons that we've learned from the past 20 months? What can we take out of this situation? We have learned that the pandemic is a powerful demonstration of the importance of primary health care as the foundation of both global health security and universal health coverage. It became clear that many countries lacked resilient national systems to strengthen or build a critical foundation for global pandemic preparedness and response. Likewise, the global network for surveillance to prevent and detect emerging infectious diseases was clearly not up to the job. The pandemic has revealed that the world was poorly prepared, or in some cases quite unprepared, to deal with COVID-19 and its consequences. The supply of medical countermeasures and tools was inadequate to ensure equitable access and fair distribution to all regions and countries of the world. There was also no strong global governance secured by proper funding and with clear accountability of the outcomes to ensure coordination of national and international efforts to counter the pandemic. A coordinating framework or platform that allows civil society and NGOs to fulfill their missions effectively was also lacking. NGOs and civil societies have an important role to play, and many achieve absolutely remarkable results and perform invaluable work. Here again, we can certainly learn something from the collaborative platform established by the Ideal Village program. We have also learned that solidarity is not an option in our response. In fact, it is critical to our success in stamping out the virus. The issue of equity must be addressed, or we face a far longer continuation of the pandemic. Genetic lineages of SARS-CoV-2 have been emerging and circulating around the world since the beginning of the COVID-19 pandemic. With the rise of variants and the current gap in equitable access to COVID-19 vaccines, we must urgently vaccinate those most at risk everywhere in the world. We cannot afford further delays in getting vaccines to the most vulnerable. To do so will mean a continuation of this pandemic and its impact on all of our lives. We must now ask ourselves some hard questions. What is the best way in which to handle the future pandemics that will certainly come? What legacy can we leave to future generations to help protect them from the devastation caused by life-threatening pandemics? What will the post-pandemic normal be like? For the World Health Organization, the new normal is the need to respond to hundreds of health emergencies at the same time as leading the United Nations response to the COVID-19 pandemic. In addition to the COVID-19 pandemic, the organization is currently responding to more than 300 ongoing outbreaks or health-related emergencies. It is important to remember that all pandemics start from a local outbreak in a village or in a city. We must learn to identify those local outbreaks and react to them more quickly. If the point of outbreak of a potential dangerous novel virus is identified more quickly and preventative measures are put in place, millions of lives can be saved. We need new, powerful systems and tools for global surveillance to collect, analyze, and disseminate data on outbreaks with the potential to become epidemics and pandemics. We must use the new technology that science is placing at our disposal to make the world healthier. Innovation and scientific progress are critical. The World Health Organization, in partnership with Germany, has, for example, recently established the WHO Hub for Pandemic and Epidemic Intelligence. This hub can tap into innovations in data science, harnessing the power of artificial intelligence, quantum computing, and other cutting-edge technologies, and promote greater sharing of data and information between communities and countries. No single institution or nation can do this alone. And the WHO has coined the term collaborative intelligence to describe our collective mission. The hub in Berlin will bring together scientists, innovators, policymakers, and civil society representatives from around the world to work across borders and disciplines, making collaborative intelligence a reality. Other initiatives are in the pipeline, including the WHO BioHub, a new facility in Switzerland for storing and sharing pathogens, and the Universal Health and Preparedness Review, a new peer review mechanism for enhancing national preparedness, modeled on the Universal Periodic Review used by the United Nations Human Rights Council. The Constitution of the World Health Organization says in its preamble that unequal development in different countries in the promotion of health and control of disease, especially communicable disease, is a common danger. The current pandemic has brought home the truth of that phrase. Ultimately, we need, or the world needs, a new architecture that is simple, inclusive, flexible, and rapid in its responsiveness. A wide range of international bodies and review panels have already met to discuss the lessons learned in the global response to the COVID-19 pandemic and has made recommendations on how the world should manage future health emergencies and pandemics. We must tap into this global collective wisdom and bring the more than 200 recommendations together in a coherent package that will deliver a stronger global health security architecture based on the principles of fairness and equity. There's emerging consensus around 4 major areas where bold action is required. First, we need better global governance supported by an instrument that could take the form of an international treaty. Second, we need better financing for national and global preparedness and response. We need a substantial increase in domestic investment, including for primary healthcare, as well as in international financing to strengthen capacities in low and lower middle income countries and to finance global goods such as vaccines. We need better systems and tools to share information. That means improved epi intelligence, improved sample sharing and tech transfer, together with optimized program implementation. Given the opportunities afforded by innovations, all countries, should be prepared to implement investigational diagnostics, vaccine and treatment protocols, and consider biomedical and social behavioral science research as an integral component of their public health emergency preparedness plans. There needs to be ongoing support for lower income and middle income countries to develop their research, regulatory, ethics, and operational capacities, learning from this pandemic. And lastly, we need a strengthened, empowered, and sustainable finance WHO to lead action against global health emergencies. It is important to consider how NGOs and civil society can contribute and work together with the WHO. In constructing the new global architecture, we must be certain that it ensures the engagement of all stakeholders in a coherent and coordinated manner. It must empower local communities and allow civil society to play its role. It may seem harsh for me to talk already of future pandemics while we're still in the midst of the current one. But we must not be blind to the fact that this pandemic is not a one-off event. The World Health Organization has been warning for many, many years that we must be prepared to face more epidemics and pandemics. It is therefore essential to ensure that the world is better equipped to detect, prevent, and counter another major outbreak. It could be far more deadly than COVID-19 has so far proved to be. We cannot say when or where the next major global health threat may emerge, nor in whose sphere of influence. That makes it critical to fully embed any new mechanism for global health threats within the broader health governance, so as to ensure the effective engagement of all countries, civil society, NGOs, academia, and the private sector, to link them into the mechanism and make them integrated parts of it. This opens up opportunities to leverage the WHO's unique global mandate, unique global outreach, and unique global legitimacy, and to place the organization, which belongs to each and every one of its member states, collectively at the center of the new governance structure. Let me conclude. The pandemic has shown us that health, as well as being a fundamental human right, is a foundation for development. There can be no sustainable, effective development without a healthy population. And health cuts across all levels and sectors of society because it belongs, or should belong, to every individual member of society. Preventing future pandemics is a race against time. It has to be a central obligation of national and global governance. Collectively, absolutely in the collaborative spirit of the Ideal Village program, over the coming months, we have critical decisions to make that will determine the future health and security of the world. What we do now will be judged by the future generations that will feel the consequences of our action or of our inaction. Thank you once again for this opportunity to address the 6th annual Ideal Village Conference. I strongly support the aims of the Ideal Village program, its concept, and its collaborative ethic. Indeed, if there's one lesson learned that we must take from the COVID-19 pandemic, I think it should be that we cannot find individual solutions alone. We must work together globally in solidarity and applying the principles of fairness and equity. I wish you a very fruitful conference. I'm sure that we will all learn a great deal from each other, and I'll be following the upcoming presentations with great interest. I thank you.
Thank you, Dr. Boehme, for this absolutely insightful and comprehensive overview of the pandemic. I have noted down the 7 lessons that we have collectively learned from this pandemic and the numerous innovative solutions that you have outlined. If you have time, we would like to ask 1 or 2 questions. since there is a couple of minutes available. Is that okay?
Sure, with pleasure. Yeah.
So here's a question from Jorge Aponte Gomez, who asks, what is the WHO doing to manage the spike from the third wave of this current pandemic?
So overall, and we are quite happy to see that across regions, we do see this week a decline, and actually pretty sharp decline in cases at a global level of 14%. So that is positive, but we still have, of course, individual countries where, there is a rise. I think, overall, we can only say again that vaccines alone are not the solution. We cannot give up, none of us can give up the infection prevention control measures, wearing masks, distancing, continue to test, continue to be alert. So that is just so important. And so as WHO, we just want to make sure that countries don't to forget about these as they increase their vaccination coverage.
That's great. Thank you. And do you have any idea of when 60%, realistically speaking, 60% of the world population would be vaccinated? Is there some kind of projection that WHO has made?
Yeah, so the issue is mainly the supplies, right? And so, we are working hard with partners all over the world, including Gavi, including the development banks, and also the manufacturers and countries, producing countries, to make sure that there are more vaccines becoming available for low and middle income countries. In many higher income countries, we have reached or exceeded the 60% already now. We're now at 40% globally of the population almost, or no, actually we've just exceeded the 40% globally, but we see this huge imbalance. And so to reach 60% everywhere, we need high income countries with a lot of vaccine supplies to donate, to give us vaccines, or to swap places so that instead, other countries can be reached with these vaccines.
Yeah. Thank you very much, Dr. Boehme. We are truly honored to have this opportunity for hearing you speak, and really very, very optimistic that the World Health Organization is at the helm of leading us through and beyond this pandemic into a safer, more equitable world. And that is truly what is at the heart of the ideal village, is holistic, collaborative, and sustainable. That is where we want to be under your leadership. So thank you so much for joining us as the inaugural keynote speaker. And we will transition to the next session. The next session is the healthcare session, and it is my utmost delight to welcome Dr. Paul Weiss, who is going to chair this session. Dr. Paul Weiss is the Richard E. Berman Professor of Child Health and Society. He's also a professor of pediatrics and health policy at the Stanford University School of Medicine. Dr. Weiss, for the last 50 years, has been a leading light in the global health arena and has served as an advisor to many governments and intergovernment agencies on the global health emergencies. So with that, I would like to turn it over to Dr. Paul Weiss. Thank you, Dr. Weiss.
Thanks so much, Sunny. It's a privilege to be here. The COVID pandemic has clearly generated profound challenges around the world, particularly in areas struggling to provide basic health services. While these areas have dramatic needs, they also have dramatic strengths. As local communities throughout India and the world have confronted the pandemic with creativity and resilience. It is my honor now to introduce three speakers who can build upon Dr. Boehme's important comments. Three individuals who have shown enormous creativity and commitment, and who will share with us their experiences, concrete actions, and vision for where we need to go. After the three presentations, we will have an opportunity for Q&A. The full bios of our speakers are available on the conference website. However, I'll briefly introduce our speakers now. Our first speaker is Sunil Wadhwani, who is the founder donor of Wish Foundation, which runs over 300 technology-enabled health clinics in some of the poorest areas in India. He has been a leader in making quality healthcare accessible to underserved populations, for which he has won numerous awards, basically for his remarkable accomplishments, contributions, and commitment to innovative healthcare delivery. Our second speaker is Dr. Raj Shah. He is a practicing cardiologist, philanthropist, and entrepreneur based in Philadelphia, and a leader in the development of telehealth solutions, including Smart Care Doc, which was the telemedicine system that was first deployed in telemedicine clinics and retail stores in the United States. Our third speaker will be a video from Dr. David Cornsweet, who is co-director and trustee of the Gumpert Foundation, a charitable trust founded in 2007. He has a doctorate in clinical psychology and is a leader in social philanthropy, an active trainer in executive leadership, program development, strength-based management, fund development, strategic planning, and practical spirituality and meditation. I'd like to now turn it over to our first speaker, Sunil.
Thank you, Dr. Weiss. I really appreciate that. Great. In the field of healthcare, if we look back over the last 20 years, we look beyond the pandemic, and we look at how healthcare has progressed, especially in developing countries, we've come a long way. Infant mortality rates have been cut in half. Maternal mortality rates have come down dramatically. Access to quality care has gone up substantially. So a lot of good progress being made. What strikes you, though, when you travel to remote areas in these countries, and even when you look at government data, is how much more there is to be done. Even today, after all of this progress, over 5 million babies and little children under the age of 5 die every year of preventable causes. And typically very simple things would save them. Hundreds of thousands of mothers die in childbirth, again, of causes that are very preventable. India, country of 1.4 billion people, it's estimated that over 700 million people do not have access to decent quality primary healthcare. Primary healthcare, of course, is the foundation of any healthcare system. If you have an effective primary healthcare system, that typically should deal with 80 to 90% of all of the healthcare issues in a community. But in developing countries, once you get outside the big cities and once you get into very low income areas, then access to good quality primary healthcare comes down quite dramatically. The challenges in primary healthcare in developing countries are big issues. The biggest one is probably the shortage of healthcare personnel in these low-income areas. So whether it's rural areas, whether it's urban slums, the shortages of physicians, of nurses, of pharmacists, et cetera, et cetera. There are shortages of medicines, shortages of equipment. When there is equipment, it often doesn't work. When there is medicine, it often gets stolen. There are bureaucratic issues. Governments are notoriously resistant to change anywhere in the world. And when you're trying to bring change to systems, there's a lot of resistance. And of course, there's the inevitable corruption that happens, within these systems, because Healthcare, is a large, complicated ecosystem in any country. There's a lot of money in it. And so inevitably, there's some level of corruption that follows all of that. The good news over these last, 10, 20 years is there is a lot of innovation happening. The not so good news is that a lot of this innovation is focused on point solutions. So for example, lots of interesting point of care devices that will cut the cost of this test by X amount, or will enable diabetic retinopathy testing, or will cut the cost of urine testing by 70%. I used to get excited by all of these innovations, but over the years that I've been doing this, I came to realize that many of these point solutions make relatively little difference when you're looking at the bigger system and trying to effect change. Again, these issues of shortages of personnel, medicines, equipment, et cetera, et cetera. So about 6 years ago, I decided to start. I'd been working with NGOs, with nonprofits in India and other countries for over 20 years, seeing these issues firsthand, traveling to remote areas in these countries, and just seeing the level of personal suffering that happens in these families, that earn less than $2 a day, who inevitably have healthcare issues happening all the time because they don't have access to good healthcare, water isn't clean, sanitation isn't good. You combine all of those things and they have all these healthcare issues. But very often the nearest clinic is 5 miles away. They go there, they lose a day's worth of work, get there, there's no physician there, et cetera, et cetera, et cetera. So I got to see firsthand a lot of this, and I felt that innovation and technology could be used to address many of these large systemic issues. So about 6 years ago, I started my own foundation in India, based in Delhi, called the WISH Foundation, with the goal of how do we address these large-scale issues in a holistic way, using innovation and technology. And there were some key principles that I started off with in this new foundation. Number one, as I said, was just taking a holistic approach, saying we don't want point solutions, but we want to tackle these issues in a broad, comprehensive kind of way. Secondly, I said partnership with government is going to be key. If we want to impact large numbers of people, and especially in these very low-income communities, in developing countries, really, it's only government that has the large-scale reach, to these hundreds of millions of people who lack this kind of access. So partnership with government was very key. The third thing I said is we need a very entrepreneurial approach to setting this up. By the way, I'm an entrepreneur, first and foremost. I grew up in India, but I've been in the US for a long time. I've started multiple companies over here in the healthcare field and in other fields, but all technology related. And I said, let's use an entrepreneurial approach over here. Let's set high goals, but let's develop substantive plans behind these. Let's try a lot of things, but let's fail fast. Let's not be wedded to one approach. If something isn't working, let's learn from that and move, to a different approach so we can see kind of what works. And finally, a lot of innovation that happens in healthcare really doesn't take cost into account that much. And to me, especially when you're talking about healthcare solutions in developing countries, cost obviously has to be a huge issue. So I said cost has to be a really important part of this. So not only do we need to improve access to primary healthcare as our goal, not only do we need to increase quality of primary care, but we should do all of this at a cost that's less than what it's costing right now to provide primary care. So a fairly ambitious set of goals. 6 years later, I'm happy to say that the approach we've developed seems to be working. We're still learning. We are now running over 700 clinics in some of the poorest parts of India. We go to the lowest income states like Rajasthan, Madhya Pradesh, Uttar Pradesh, Assam, and so on. We're working in Delhi, but again in the urban slums in Delhi. So we're running over 700 clinics. Since our startup, we've served over 20 million patients, and we provided free healthcare to all of these patients. We share the costs of this with government because, again, government is our partner. And in doing this, we've learned a lot of lessons along the way. We are doing all of this work on the ground. We get to see what innovations work, what don't work. So our 700 primary care clinics give us kind of a living lab to see what innovations work and what don't work. And the basic model that we've developed for any of these clinics is very simple. Patient comes in, We set up an electronic health record, which is lacking in most of these healthcare systems. So then you can follow the patient longitudinally. Secondly, we've developed with local innovators a set of smart diagnostic devices that not only do all of the 30, 40 tests that are typically needed on most patients, but they can then transmit the data to a patient, to a physician who might be sitting, 50 miles or 100 miles away in a city. The third part then is, of course, the physician consult. And because of this shortage of, physicians in these low-income areas, we bring that in through telehealth. And the next speaker, Dr. Raj Shah, is an expert in this field and will be discussing that with much more depth and insights than I could. So we bring in the patient through telehealth into these clinics. And then typically in most cases, the patient needs medicine of some type. Now, in these low-income areas, again, there's a shortage of pharmacists and pharmacies. So with a local innovator in India, we developed a medicine vending machine, which is kind of like a Coke or Pepsi vending machine. It's stocked with 80 or 90 of the most commonly used medicines in these areas. And the physician who's sitting 100 miles away can hit a button on his keyboard. The right medicine pops out in the clinic where the patient is, and this is right after the physician consultation. And while the physician is talking to the patient, the medicine pops out, patient takes it, and the physician explains to him or her, the patient, here's how you take it. Beyond that, so the patient then leaves. We have supply chain management systems, very simple ones, but very effective, that track medicines, that track stockouts. And not only are we able to that way keep medicines in stock, but having these systems also discourages theft from the system, because otherwise in these countries, medicines get stolen in giant quantities. But the fact that you track these on a real-time basis cuts down on all of that. And then finally, we apply data and analytics to all of the data that we gather on patients, not only to better manage individual patient health, but to help us better manage population health and to predict, kind of what was likely to happen and how do we manage all of that better. So we integrate all of these different forms of innovation into what we call digital health and wellness centers. These are, again, basically primary care centers, but they are digitized in all of the areas that I've mentioned. And we have close to 100 of these digital health and wellness centers operating right now in India, treating patients, and everything that I've just mentioned to you is all working in a very integrated, very holistic kind of way. The cost, so quality of care goes up dramatically because we track a range of whole quality measures in all the work that we do. And we find that quality goes up dramatically. So whether you look at vaccination levels, number of ANC visits, and other typical primary care quality measures, these go up dramatically using the approach that I've outlined. Access goes up dramatically for patients in these low-income communities because now you've got clinics where you can get a physician consult, there are medicines, et cetera, which doesn't exist in many of the existing places. And finally, cost. We brought the variable cost of every patient encounter down to close to $3 per patient encounter. Our goal is to get it under $2, which I think will make this the most cost-effective primary care program anywhere in the world. So better quality, better access, and lower cost, thanks to innovation and technology. So that's where we are. This model that we have, the WISH model, of innovation in primary care, is now attracting a lot of attention. We're working with several governments, state governments in India, as well as with the national government to see how we can expand this and roll this out much more aggressively on a national basis. We're getting interest from other developing country governments around the world, from Africa, from Asia, from Latin America, and hopefully fairly soon we'll be able to start working in these regions. So overall, right now we've got the, and one last comment, the pandemic has put a lot of this obviously on steroids. Telehealth as an example, and again, Dr. Shah will address this in more detail, has been used for the last 5, 7, 10 years. But the pandemic obviously dramatically raised, the usage of telehealth globally, developing countries as well as developed countries. And so I think going forward, the good news is that I think we're at an inflection point right now. We've got the Sustainable Development Goals that have to be met by 2030, 9 years from now. That's not too far away. At the current trajectory, I think we're going to be challenged to meet those goals. But the good news, like I said, is the kind of innovation that's happening in these new delivery care models. And what we've done at my foundation is only one example. There are other really interesting examples being developed in Asia, in Africa, and other places. And as these get propagated, I can see change accelerating. The other good thing is that in recent years, governments in developing countries, both national governments as well as state governments, are now more open to working with civil society, to working with the private sector. They're open to new ideas. In fact, I would say they're hungry for new ideas. So I think the time has never been better for this partnership, to work with government to implement and to scale these new innovative models of healthcare. And doing that, I'm very hopeful that we can then accelerate the progress we're making in healthcare to give us a much better chance at meeting the goals in 2030. So with that, thank you, Dr. Anand and Mr. Kamath, and it's been my pleasure to be over here. Thank you for the opportunity to speak to everyone.
Thank you so much, Sunil. Remarkable accomplishments and insights. Now turn to our second speaker, Dr. Shah. Raj.
Can you hear me?
Yes, we hear you.
Okay, I need the screen
Loud and
share.
clear. Loud and clear. Thank
All
you.
right. Greetings from the birthplace of United States, Philadelphia, which has been my home for the last 50 years. I'm a cardiologist, but more important, in addition to the healthcare of patient, healthcare delivery using technology has been my passion for the last 50 years. I would like to sort of set the stage about the topic of my talk this morning about telemedicine. But before we do that, if I may have use the share the screen and bring on the first slide. Can everybody see my first slide?
Yes, please go to full presentation.
Yes, thank you. Okay, so one thing that brought me in this fold of technology was recently my association with Wills Global Foundation, which is IIT Indian Institute of Technology alumni who have started this charity organization. So let's set the stage about telemedicine solution. But before that, how we are using and our mode of healthcare delivery.
In the past week, we have seen a rapid escalation of cases of COVID-19.
Could this be something that spirals into a large lethal pandemic?
World Health Organization declared the outbreak an international public health emergency.
This is like a flu on steroids.
Throughout history, healthcare has been delivered in person. However, cost, convenience, and geographical barriers often pose challenges for patients to access healthcare. So many patients are not able to see a doctor or healthcare provider.
So our traditional healthcare since the last 5,000 years has been always in person. But during pandemic in particular, the traditional in-person healthcare is not possible because of severe travel restrictions, lockdowns, curfews, lack of transportation. And when you are in this situation and pandemic occurring and affecting millions, how do we deliver healthcare to these people? How do we take this healthcare to them? So that brings us to best alternative, which is remote healthcare delivery, so-called telemedicine. tele means from distance, and medicine, practice of medicine. This was my passion, and in 2012, we are the first one to put together a system which can be deployed as a freestanding telemedicine clinic, whereby not just the video conferencing to see the patient, but also integrate common diagnostic devices so we can actually evaluate the patient and replicate the office, replicate in-person visit. Now, this devices and the system is not inexpensive. It costs money, and the devices have to be at the patient side, and every patient cannot afford. So for most part, we are using video visit or FaceTime or Skype or other means of connecting and seeing and talking to the patient. But we do lack our ability to quick evaluation of the patient. And this costs money. And in our keynote speaker and esteemed speaker, Mr. Wadhwani, they brought in light, in focus, the access to healthcare. Major problem, and access is limited because of number of reasons, but the most important being affordability. A person should be able to afford, and what we bring to them has to be a cost-effective way of providing care. That was our emphasis. So when we look at our rural communities, take country like India, 800 million plus people live in villages. Villages where poverty, the average income is 45 cents per person, or maybe $2 per family. There is lack of education, lack of clean water supply, sanitation, electricity, lack of roads and transportation. There are no healthcare providers, there are no hospitals, there are no clinics, there is no medical supply. And how do we, and look at this, the challenge, how do we deliver and take care of these people? That is a real challenge. And this challenge, even before pandemic, since last year, we have been working how to bring about access to healthcare for these people. So working with, as a mission of WILS Global Foundation, and by the way, WILS, acronym WILS stands for water, healthcare, education, energy, livelihood, and sustainability. All these which are the overarching areas which makes an ideal village were encompassed in our WILS Global mission. And I'm the chairman of the Healthcare Council, and my role was to come up with a solution how we can bring access to affordable healthcare. WILS Global is not a funding organization. We don't have a lot of resources to do that. So we had to work in a very economical way to bring, and we created so-called healthcare easy access for rural communities via telemedicine. Acronym stands as Heart Center, and of course, heart being at my heart being a cardiologist. What is a Heart Center? It really is. It is simply where we take a hardware, make it a kit, which includes a smartphone and basic vitals like thermometer, pulse oximeter, blood pressure scale, glucometer, etc., and give it to a resident of the villager. Yes, we can take the healthcare to the doorsteps of the villagers, but that costs money. You need a van, you need personnel, you need healthcare worker. We don't have that, and we don't have those resources. So here we train a villager, resident of that village, train them very quickly, give them this hardware and software. And I'm very pleased to say that our technology partner, Evolco, which is company is in Silicon Valley as well as in India, have a phenomenal infrastructure with more than 200 physicians on their panel and 300 staff, which are actually going to each village. They train this villager, give them the supply very quickly. So the supply and this, everything is there and put together. This has enabled us to quickly set up more than 350 telemedicine sites in villages in 7 different states. And we continue to expand. Of course, we are limited by the funds, but whatever we have been able to do that. Now, each center, each can see 15 to 20 patients. So we are capable of seeing 2,000 to 3,000 patients every day. And I'm pleased to say in last 2 months, just from starting and ramping up, we have already seen more than 10,000 patients. And here we are providing a first-hand care, evaluating the patient, triaging it, and starting the treatment if needed based on the evaluation as well as examination done by using simple devices. This has helped to reduce the run to the hospitals or clinics, which are already overwhelmed. And now our villagers are getting care right at their home. And that is the beauty. Evolco company has their own physicians, and we are happy to say that some of the state governments has allowed their primary health center doctors to come on and provide the care. To this point, we have been able to provide the care free of charge. In addition to this, because we had from generous donations, we were able to provide oxygen concentrators, some vital life-saving equipment. We also partnered with research institution, IITs in Delhi, Kharagpur, Madras, to help them to find solution for cost-effective oxygen concentrator, early diagnostic kits, etc. And we're working on that. So this is the mission of Wills. This is our vision. This is what we have done to this date. And I'm very happy to say that just having $300, we can provide this care to thousands of patients. The first primary healthcare, not just the, and it is a basic primary healthcare evaluation as if the patient would be getting in person. That's the beauty of our heart model. Now, as we are doing it, obviously the lessons learned from the difficulty and the barriers that we had to overcome. The barriers, difficulties, lesson learned has very well articulated by our keynote speaker, Dr. Boehme, and lessons learned and being learned by my colleague, the previous speaker, Sunil Wadhwani. But same thing that we came across and the lessons learned, which can be put into 2 broad categories. We need to be prepared and have planning. Planning for access to affordable healthcare. Healthcare facilities, ability to quickly set up facilities for providing care. The schools which are present in every village can be quickly turned into the mini hospital, and teachers can be trained to become a first healthcare provider on the first line. Building adequate resource and rapid production of the life-saving equipment and managing the supply chain are very important. But when pandemic occurs, most important thing is a single disaster management agency should be empowered to take control and command based on data and science without political interference. This has been a problem experienced everywhere, including United States and India and all countries. Because unless we have that, it becomes very difficult. It becomes very piecemeal attempt to a massive problem. And this would require, particularly for healthcare, a proper data collection, analytics, emergency procurement and production of equipments, rapid testing, rapid development of treatment, vaccines, etc. These are the things that we have to plan for it. For the healthcare workers, to bring them from all over the world, a licensing and professional liability issue should be quickly answered so that people can get the care. And on top and above all, mass education and awareness to alleviate fear, anxiety, and proper preventive measures would go a long way to deal with endemics. Now, going forward, this is during the endemic. We need to continue build up on this aspect and providing a wide spectrum of healthcare. And again, keeping the same principle with the heart center, provide more diagnostic devices at the point of care, more equipment. And this model works so well because this business model where we have one system and many users, just like what we had, one telephone booth and many people were going till everybody got telephone in their pocket. This will work and continue to provide healthcare, and we can build on not just the treatment, but screening and triaging, bringing in all the data, bringing in their vitals and diet activities, risk factor analysis, behavioral changes, decides on the treatment and follow-ups. All these things can be built on this simple heart model, which is inexpensive. I think creating a full model will need about $1,000 for each center. But think about it, $1,000 for one center in one village will create 1 or 2 jobs for the people who are trained there, resident, create livelihood. And going forward, we will start collecting the fee. As Sunil said about cost of variable cost is about $3. We can bring it down to $1.50 or equivalent to 110 rupees, giving doctor 50 rupees for consult, 30 rupees for the salary and technology cost. This will, even at this point, it will save patient 500 to 2,000 rupees for receiving their care. And if we can build just 1,000 sites at a cost of $1 million, we can serve 10,000 patients a day, 3.6 million patients a day. And since this cost is covered, this can be perpetual with the highest impact as we can build on this model. Going forward, we also need to take care of not just the treatment part, but as I said, preventive and overall primary healthcare, which can be delivered using this heart model and the equipment. I'm very delighted. I know this is a busy slide, but I just want to say, just in last 1 year, so our technologist friends are working on it to provide biometric sensors. So all these sensors could be on a simple watch and that can be used. University of Cincinnati has a portable smartphone lab, just a credit card which can be connected to the smartphone, can perform many tests at the sub point of care. Where Apple and Google partnering for tracing, University of Washington with Microsoft developing to capture vitals, just looking at the camera of the smartphone. The Northwestern has developed a patch which if put on the throat, can from the throat movement and the breath sound can actually monitor heart cell and temperature. Northwestern has created a wing microflyer microchip, like a mosquito can fly and can monitor the pollution level or the spread of the airborne disease. And finally, just 2 days ago, the Prime Minister of India, Mr. Modi, declared Ayushman Bharat digital mission that will revolutionize the care. And one part of that is health card. So every patient will have their card, which have universal connectivity and will be able to carry their record in their pocket. Of course, there's so many attachments to the a smartphone for eye disease and skin disease. So our technology friends are creating a phenomenal way where we can bring cost of technology down, convenience of having it right at the point of care, and the future we can take care of these people effectively and in a very cost-effective way. And lastly, Wills Global, not only just the healthcare.
You're a little behind, Dr. Raj. If you could please conclude.
This is my last slide. I'll finish. That Wills is involved in Ideal Village, Smart Village, and we are recognized by Niti Aayog for technology transfer and innovation, working not just in healthcare, but education, clean water, etc. And finally, my appeal, join us in this mission to change the lives of rural India. Thank you so much.
Thank you so much, Dr. Shah. You've been a pioneer in telehealth, an area whose potential role in healthcare delivery more broadly has been underscored in response to the pandemic. Thank you.
Thank you.
Our next presentation will be a video by Dr. David Cornsweet, and we will then have a period of Q&A available for all of us to discuss these presentations.
Good morning to you all, and thank you for allowing us to be with you today and to share some of our work in the field of medical services for the poor in rural India. This presentation will focus on the desperate need for medical facilities and our response. The recently inaugurated Sri Satya Sai Sarla Memorial Hospital. This hospital was named after the world-renowned humanitarian Sri Satya Sai Baba and Sarla Shah, an incredible woman whose compassion, caring, and dedication to selflessly serving the poor and those in need is truly inspirational. This hospital is located in Mudanhalli, a small village in the Chikkabalapur district of Karnataka state in India. Now, India has a desperate need for rural healthcare. Close to 70% of India's population lives in her villages, yet 80% of all healthcare facilities, medical manpower, and support services such as labs and imaging services are concentrated in urban areas where only 30% of the population lives. Despite having one of the largest medical school systems in the world, with an annual intake of over 50,000 students, very few doctors work in rural areas. Of the over 25,000 primary healthcare centers called PHCs, which serve the rural areas, more than 8% of them don't even have one doctor. 38% don't have a lab or lab technician, and 22% don't have a pharmacy. Imaging services, even those as basic as x-rays, are rare, and emergency services are virtually non-existent. Now please consider this, and this information is from the Indian Journal of Public Health. When looked at as one integrated nation, the ratio of doctors in India to people is 1 to 921, which on the face of it is not too bad. It's pretty good, considering that the World Health Organization recommends 1 doctor for every 1,000 people. Even when you remove the non-allopathic doctors, and I do value them, you're still at 1 to 1,400, which is not too bad. But when you look at services in rural areas, the picture is drastically different. These doctors account for only 5% of the total number of doctors in India. 5%. The numbers in Karnataka state are staggering. There's only 1 government doc for every 13,556 people. Overall in India, the ratio is only a bit better, with 1 government doctor serving a population of 11,082, which is still 11 times the minimum recommended by the World Health Organization. Lacking effective insurance, over 68% of healthcare costs in India are paid for out of pocket. This is while the world average is only 18%. And this is pushing many Indian families into poverty. In fact, over 60 million fall into poverty each year directly due to catastrophic healthcare expenses. While India cut poverty sharply from 2011 to 2019 with a notable increase in the middle class, this trend was dramatically reversed in 2020. As COVID-19 has spread throughout India, it has pushed India's middle class closer and closer to poverty. In fact, India now leads the world in people falling below the poverty line since the pandemic began. By taking a look at the Chikkabalapur district, we get a graphic understanding of this untenable situation. With a population of close to 1.5 million people living in close to 250 villages and one urban center, this district has a total number of 55 government PHCs. These PHCs can only provide the most basic rudimentary care. Now, the emergence of telemedicine has helped somewhat, but even where it's available, care is hampered by the lack of medicine because there's no pharmacies, and the lack of medical supplies and treatment facilities. As was recently reported, India in general was overwhelmed by the need for oxygen during the COVID crisis. This was true in almost every urban area, but was even more desperate in the rural areas where oxygen supplies were almost non-existent. Now, I want to stress at this point that this is not due to the lack of efforts of many government officials. Many of them try, but cannot do anything on their own due to the lack of doctors, the lack of funding, and the lack of equipment. Maternal and prenatal care is very difficult to come by, and obstetric delivery services are generally found only in the larger urban areas. Now, this is usually not a problem unless there are birth complications. In those cases, it can be tragic. One state, Madhya Pradesh, reported that over 72,000 infants died due to the lack of adequate medical services in a recent 9-year period. One can only imagine those numbers for the entire country. To say that there's a lack of emergency services is an understatement, a tremendous understatement. Emergency rooms are rare except in the largest town and urban areas. And ambulances often don't have qualified paramedics in them and lack even the most basic equipment. Many don't even have oxygen. And when you consider that in the rural areas, ambulances are often an hour away and transportation to an adequate medical facility can take 2 to 3 hours, you start to get an idea of the severity of this need. It has been reported that many villagers simply don't even seek medical attention anymore due to the lack of availability, the high cost, and other factors. They've given up hope. During the pandemic, the lack of ICU beds and high dependency unit or HDU beds became sadly apparent. With a population in excess of over 1.5 million people, the entire Chikkabalapur district had less than 50 total combined ICU and HDU beds. And Chikkabalapur is considered one of the better prepared rural districts. Now, with the guidance of our spiritual teacher, Sadhguru Sri Madhusudan Sai, who follows Satya Sai Baba's teachings of love all, serve all, a massive effort was undertaken to build a hospital to begin to address this need. With a total of 8 wings, this state-of-the-art, multi-specialty hospital would have an in-house oxygen plant and would provide 3 modular operating theaters along with 125 HDU beds and 25 ICU beds. However, we needed to rethink that. We quickly realized that the idea of a total of 150 beds was impractical. Now, this hospital will provide 300 beds, all with oxygen and state-of-the-art monitoring equipment. 150 of these beds are already available. Supported by a full laboratory, a blood bank, a pharmacy, and serviced by a fully equipped ambulance service with paramedics, this 66,000 square foot structure will provide daily care. On a weekly basis, other specialty care will be provided, and a 24-hour, 7-day-a-week emergency room. Due to the current pandemic, we're also preparing it to serve as a COVID care center. Initially, it was difficult to put together a labor force due to the COVID crisis. However, in the few weeks prior to our scheduled inauguration, A team came together of over 200 primarily local workers who worked in 3 shifts round the clock. Now, if you take a look at this next slide, you'll see what happened between July 19th and the inauguration on the 24th of July, a period of only 5 days. The success of an effort like this is based on 3 factors, which are like an equilateral triangle with each side supporting the other. One leg is the government, one leg is charitable organizations, the third leg is the society, including individuals and businesses. The state government here has been very helpful. They provided support by clearing all of the necessary permissions and also helped to establish bus and train stops to help those needing transportation. Dr. K. Sudhakar, the State Minister of Health, Family Welfare and Medical Education, has been working side by side with us since the inception of this project. On the 27th of July, Sri Basavaraj Boehme, the Chief Minister of the state of Karnataka, visited the hospital, and at that time he promised his government's full cooperation in each and every aspect of this expanding project. Businesses and charitable organizations contributed supplies, equipment, necessary consultation, as well as all required financial support. One example of how individuals supported this program happened one night late, very late, right before the inauguration. One worker was seen working long past his shift, and it was suggested to him that he take a break and come back in the morning. He simply refused. It seems that his father had been treated at one of our hospitals and his life had been saved. When he went to pay the bill, he was told that there was no bill, that all treatment was completely free of cost. Now, he said this was more than just payback. He believed that this hospital was a gift of God to the people of his area and his village, and he wanted to do everything he could do to help. This sentiment was echoed by many other workers. In fact, many of them refused any overtime pay. What they said was that they would accept pay for the regular shifts, but the overtime and extra work was their gift to this effort. Now, one thing our spiritual teacher has told us is that the reward for good work is more good work. Accordingly, on the 27th of July, we had a groundbreaking ceremony for the second phase of our effort, which is titled the Sri Satya Sai Rajeshwari Memorial Block. This block is named after one of the most brilliant, compassionate, and caring physicians in recent history. Dr. C. Rajeshwari was a professor of obstetrics and gynecology for over 25 years. Additionally, she had highly successful practices all over the world, including one at Stanford. But we're not stopping with the second phase. Noting that the sheer cost of a medical education prevents many from serving in rural areas, we already have applied for and are in the process of getting approval for an absolutely free of cost medical school that will produce doctors, nurses, and paramedics, as well as provide existing doctors with training in specialty areas. That makes this complex not only a state-of-the-art medical facility, but also a multi-specialty training and teaching hospital. When completed, the entire medical campus will have a total of 7 modular operating theaters, over 40 ICU beds, over several hundred HDU beds, which will bring the total number of beds in the medical complex to 460. It will also have kitchen facilities to provide food to patients and staff, and will provide free housing to the medical staff. Quite honestly, I was stunned when given the timeline for this project. The medical school will open in August of 2022. Now, I was stunned, but I wasn't in disbelief. We had already seen what was possible when good government, caring businesses, dedicated people, and philanthropical institutions come together, working for a common cause. Sri Satya Sai Sarala Memorial Hospital has proven the concept. We know it can be done, and we will do it. I'd also like to take this opportunity to thank all of you for all of the fine work you're already doing. And thank you for allowing us this time to talk to you about the work we're doing. Namaste.
Thank you so much, David. Just remarkable accomplishments, and want to thank you for this important leadership in meeting comprehensive healthcare needs in profoundly underserved areas of the world. We will now turn to a Q&A session, and I have been tracking the questions that have been coming in through the site, and I will summarize some of these, synthesize some of these. And I want to begin with the fact that many of the questions have been focused on the implications for concrete local action. We know that the pandemic has burdened certain sectors of healthcare, ICUs, hospitals, emergency rooms. But what lessons can be learned at the local level? Looking forward, has the pandemic weakened local primary care, community health worker systems, for example, or paradoxically, how has the pandemic actually strengthened these systems in building a response to the pandemic? And I'd like to ask first, David, if you could respond to this question.
Sure. One of the things that happens in a situation like this is the need gets pointed out. And then, as I've heard today already, there's been like amazingly new technology and new ideas that come forward. And so even though this is a tremendously difficult time, we're starting to see some real hopeful changes here. It's going to take time. I was listening to the idea of the telemedicine clinics that just seem brilliant. It'll still take time to roll them out. The key here is actually getting to the villages. And one of the things that Sundar was talking about when he mentioned Rogivahini, which is up in Calcutta, which services a number of villages around Calcutta, is these outreach programs that are supported by the technology of these companies that are so generous. And they get out there and they really boots on the ground help. And then, of course, another thing that's coming out of this pandemic, from my perspective, is we're seeing many, many hearts open up. And that's followed by concrete action, not only in the form of donations, but in spreading the message. I mean, one of the panelists was mentioning $1,000 to set up a clinic. I mean, that's an amazingly low cost. And I have no doubts at all that he's going to be flooded with offers.
Thank you, David. Raj, do you have anything to add?
Yeah, I think the pandemic obviously brought to focus the alternate means of delivery and how quickly we can get there. Our experience has been that we can, just in 2 months, we created 350 sites. So it's only thing we are limited is by the funds and occasionally infrastructure presence of cellular or telecommunication facility in that village. If not, when we change our modality from somebody going from outside, even with a mobile van, somebody who is not known to the community, when we train the 2 people or 1 person who is actually resident of that community, the acceptance is phenomenal. People trust that person and look at the cost. We reduce the cost to like $300 for the basic, or maybe when we expend $1,000. And then if we collect small amount from the patient, it becomes perpetual. It creates jobs, provides care. Because even though we train all the doctors and everybody, once they get trained, they are not going to go and make their home in those villages, unless the village has become ideal and provide all the amenities. They're all going to migrate to the urban or suburban area for their practice. So this will be a problem for a long time unless every village becomes an ideal village. And to that point, and up to that point, we have to rely on remote healthcare using the best technology, and technology has to be cost effective. If something costs $1,000, it's not affordable. So our technology friends, thanks to them, have to bring down the cost, make it accessible, and we can do it like this. I think in my practice of last 45 years, I've learned that by trial and error, this was the best way to make the highest impact, the biggest bang for the bucks, and provide the care and all kind and complete care, except you're not touching the patient. But Carnegie Mellon, if remote touch become possibility, that will also be very easy. So we'll bring remote care to every villager. And I think that is a future, at least in foreseeable future, where we can bring and scale up.
Thank you both. Perhaps the most striking lesson of the pandemic has been that successful public health initiatives require legitimacy. They require trust in the systems of public health, trust in their leaders. Sometimes this trust, this legitimacy is affected by political interference or indifference or political legacy. How can technology enhance public trust in public health? How can it elevate the voice, particularly of trusted local leaders who in fact embrace essential public health initiatives like vaccinations and the use of masks? Raj, you want to take that first? And
yes.
Then we'll talk with David.
The best way to create trust is to have a local person, resident of that village, sometimes a leader called a sarpanch, who is like a small local government leader. Once you win the trust of that person and just give a little bit education, how it can help their people in that village, I think things becomes very easy. And to me, that is the surest way, because villagers are going to listen to their leader, sarpanch in that town. That person, that's a key person where we have to teach them. Have those who are serving be that resident of that village. That's very important. Not somebody coming from outside. Not that if they're sick, they'll take that, but their trust is highest in that person who is part of their community, who speaks their language, who knows their custom. That's where we'll be able to build it. And that's very easy and very cost-effective way to bring total healthcare and all other aspects of the ideal village to the village.
And if I could just pursue this, you work in telehealth, you work in technology. How can those capabilities enhance or at least integrate, create collaborative frameworks for local leaders to address these issues and gain the information they need to reach their local communities?
It would be either remote or in person. They can be trained by either spoken tutorial or video or other educational material, or there may be some kind of a teacher periodically go and have a conference with them and give that in person. Teaching them the use of technology and simple testing, again, and a support on an ongoing basis will go a long way to bring that together.
Thank you. David, do you have some thoughts?
Well, yes, I 100% agree with Raj on this. It's one of the reasons that we've integrated locals in everything we do. And they actually reach out. We do a lot of educational work in the villages done by them, and we train them. It's like even, I didn't mention this in the presentation about the medical school we're doing. We are going to primarily be bringing in the village kids for this. And there's going to be a little trade-off here of they'll get the free education, but we want them to put some time in the rural areas. And the thing about the technology, one of the things that is so effective, especially when you get in the field that what Raj is doing, is when people see it work and they see it with their neighbors, they're more open to it. And this whole idea of starting to use the strengths that are in the village already to help build out and supply the need for healthcare it's brilliant, and we've seen it work. I mean, we mentioned in the beginning, I think Sundar mentioned the cardiac care hospitals that we have, and we have educational systems with 5,000 kids. When we get to the villagers and we touch them, it builds trust eventually in us, but initially on the people who touch them, that are the villagers themselves. I love Raj's idea of training people to help deliver the healthcare. We're doing that. And I think that needs to be done, because when people look at a federal government or national government, it's too far away. In the villages, they trust each other. Villages oftentimes feel like a family, and family trusts family.
Thank you. Thank you both. We just have a few minutes, but I do want to raise another theme that's come through in the questions. And that is, the information shared in this conference is incredibly important. However, unless Sunny wants to put this conference on every day, which I doubt, how can communities, NGOs, public agencies continue to share and learn from each other, the successes, but also the failures? What are the best ways that you would suggest to continue the discussions that we have initiated today? Raj, can we start with you?
Yes. Over the last year and a half during pandemics, we have done more than 15 or 20 webinars. We have invited many thought leaders, visionaries, just like annually we do at Stanford. We need to create a community of these leaders, the visionaries, all of us, and provide us a platform so that we can intercommunicate and build up on our synergies and use the resources we have. That will have a tremendous impact across the board. Because what happens is, like David and I and Sunil and we, after finishing conference, we are on our way. We don't remain connected. I have come across so many people in last 2 years who are who's who leaders, visionaries, but how to remain us connected. Perhaps you can form maybe a WhatsApp group or a web or a speakers group or something where we have contact information. We can pick up the phone and say, hey, David, you are doing this in this Karnataka district. We are doing it in Anandpur district in Andhra Pradesh. How can we combine? How can we use your resources and bring into the village where we are doing it? How we can get to the donors to help us to do this? If we did that, our own interconnectivity would be a phenomenal vehicle to bring this to where it is needed. That has been my my suggestion. That if
Thank you, Raj. David, last comment.
Well, I love that idea. One of the things that this conference has done is it's provided like a kind of like a foundation for us to talk from, but it needs to be more regular. And we have a group of study circles that are going on a weekly basis globally with one aspect of the work that we do. And it might be a very interesting thing to set up from this conference, to have it as an outcome of this conference, to have at least a monthly and maybe even more frequently, like a study circle for those of us in the field, so we can study what we're learning from each other. I've learned a couple things today that I didn't know were going on. That idea of kind of like the vending machine for medicines. Oh my God, I love it. I love it. And you can bet Sunil's getting a buzz from me as soon as that's possible. As soon as he gets back from where he headed, I'm going to be on him about what that's like, how it's set up. So this idea of bringing together people more frequently, maybe in a less formal way, where we can just kind of sit and chat. You know, there's an expression in Sanskrit, Vasudeva Kutumbakam, the whole world's a family. Well, maybe this part of our family needs to talk more.
Thank you, David. Well, I want to close this session by first expressing our gratitude to the speakers, recognizing some of the important recommendations coming out of this discussion. and to the speakers for sharing not only their wisdom, but also inspiring us with remarkable examples of decades-long commitment and significantly accomplishment. Lessons for us all. Thank you again. Back to you, Sunny.
Thank you, Paul. Thank you, David, Raj, and thank you to Sunil Wadhwani, who's traveling right now. I think one of the main functions of providing this conference as a platform is to bring like-minded people together. And in the past 5 years, several collaborations have resulted that allowed different NGOs to scale their programs significantly more than what they were able to do on their own. We are also in the process of creating a live database, which will sit on the Stanford University website, where we will have solutions for healthcare, education, water, sanitation, and all of these domains. And these, so that people who are interested in starting a program can match up the needs of their program and the conditions in that village to other places, other villages where similar programs have been, safely, effectively implemented. So with that, I'd like to move on to the next session, which is on education. And it is my absolute delight and pleasure to welcome Dr. Donald Barr. Don Barr is a professor of pediatrics in the Stanford School of Medicine, and by courtesy, a professor in the Graduate School of Education. Don is not only a wise and insightful educator, but he's also a well-known author and has published celebrated books on US health policy, and more recently, his book on health disparities in the United States has been widely acclaimed. He's also a teacher at heart and has inspired generations of students at Stanford University. With that, Don, I would hand over to you.
Thank you very much, Sunny. And I'm very pleased to be here and to have the opportunity. I have four very distinguished speakers who are going to work with me. I'd like to just tell you a little bit about each of them, and then we'll move on to their presentations. The first speaker will be Dr. Kalyan Chakravarthy. He is the founding executive director of the Penn IIT Alumni Research for India Foundation, the Penn IIT Alumni Foundation. The foundation is a nation-building initiative with the mission to enhance incomes of the underserved by enhancing vocational education through nonprofit joint ventures with the state. He is a member of the Confederation of Indian Industry National Skills Committee and is an active participant in policymaking platforms. Our second speaker will be Dr. Kristina Hesbol, as an associate professor in the Educational Leadership and Policy Studies Department at the University of Denver's Morgridge College of Education, where she teaches doctoral leadership and research methodology courses. Her teaching, research, presentations, publications, and service converge on the impact of culturally responsive schools leadership and district leadership with a focus on improving rural education systems. The next speaker will be Dr. Ann Lopez, who is a professor of educational leadership and policy at the Ontario Institute for Studies in Education at the University of Toronto. She is a scholar with public education experiences as a former secondary school teacher and administrator in Ontario, Canada. Dr. Lopez is the director of the Center for Leadership and Diversity and provostial advisor on access programs at the University of Toronto. Her research and teaching focus on challenging inequities in K-12 education and schooling, decolonizing education, particularly in the area of school leadership. And Mr. Robert Fung is a career educator and champion of equity for students. He currently serves as principal of the San Diego Met High School in the San Diego Unified School District. As an educator, he focuses on improving educational experiences for students by creating learning environments that are personalized, differentiated, and equitable. He leverages his background in community outreach and internship coordination to help schools and educators integrate real-world experiences into their students' lives. So we will look forward to each of the presentations. We'll start with Mr. Kalyan Chakravarthy. Kalyan.
Thank you, Don, and it was a wonderful introduction. Appreciate Sunny and Sundar and all of you to invite me at the obviously wonderful conference of Stanford Ideal Village, and special mention to Wheels team as well. They've been very, very supportive. And so without further ado, let me just jump in quickly. So I have a 2-minute clip. Today's theme is some ground experiences from India on how vocational education can transform both lives and livelihoods. So I have a 2-minute clip from National Geographic, which got featuring us. So let me just play that, and then we will get started after that.
Pan IIT Alumni Reach for India Foundation is a not-for-profit social enterprise led by the alumni of Indian Institutes of Technology, IIT, committed to creating self-sustainable business models that enhance incomes of the underprivileged. The foundation runs a demand-led training program that is a joint venture with the government of Jharkhand for skill development in the state, ensuring assured placement for students nationally and internationally, and a trained skill base for the industry hiring them. Candidates also receive 100% skill loan through NABARD to support their training. The loan is only payable after the student has completed the course and has been placed in a job. This helps students from less privileged backgrounds to take advantage of the skilling programs.
ये नर्सिंग कौशल कॉलेज है और मेरी फैमिली कंडीशन उतना अच्छा नहीं है कि इसमें लोन प्रोसेस के द्वारा पढ़ाई कराई जाती है, जिसमें कि घर से पैसे नहीं लगते हैं। कॉलेज बहुत अच्छा है क्योंकि इसमें फैसिलिटी ज़्यादा है और यहाँ थ्योरी क्लास के साथ साथ प्रैक्टिस पर ज़्यादा ध्यान दिया जाता है कि इसमें हाई टेक्नोलॉजी के द्वारा पढ़ाया जाता है, जैसे कि सिमुलेटर है, यहाँ वार्ड बनाए गए हैं, जैसे प्रैक्टिस वार्ड है, ICU वार्ड है।
Yeah, that's the brief background of what we've done, and it's wonderful that we've got this platform to kind of give our 2 cents on how we can kind of look at vocational education and rural skilling. Thank you again, Don, Sundar, and Sunny. In fact, I've had the good fortune of meeting Sunny at his Stanford office and obviously learning a lot from his work in India with the whole bunch of hospitals and everything else that he's getting involved in, and of course Stanford is inspiring. So incidentally, we are as alumni. I represent the Alumni Foundation of Indian Institute of Technologies, which is a very familiar name, I'm sure, for the Stanford folks. So the Pan IIT Alumni Foundation is about how IIT alumni of the IITs come together to kind of give the benefit that they've got from the public education system to a system which is in the vocational space called ITIs or vocational nursing. So fundamentally, the idea is how do we kind of give the good stuff, the spirit that we've learned from the IITs at the same level to vocational education at the bottom of the pyramid. So I will just take about another next 10 minutes to kind of quickly delve you into a case study, because I think it's useful to get perspectives from the ground. And being Stanford centric school, and I've seen all of the initiatives involved with the med school, School of Education, and the business school. The tech-based vocational nursing education is, like the lady explained in the video, it's a very exciting proposition. And uniquely, this is actually a prescription that is also saving both lives and livelihoods when we talk about nursing education, because I will explain to you what has been happened. So we are India's largest public. A&M in India stands for Auxiliary Nursing and Midwifery. It is a vocational nursing equivalent from US. We are actually India's largest network of public A&M education systems. We've built this practically just before COVID, so we were very well geared. Capacity is fairly huge. We do about 2,000 nurses concurrently at any point in time. And this typical state toppers, everybody comes from in here. And the whole way it is kind of working, and this is the first part of it. The entrance exam is actually based on merit cum mean selection. We have close to 17,000 kids who write for 720 seats. So the admission is difficult, but the good news is it's not based on purely merit. After the cutoff, the students actually are ranked based on their poverty. So we have orphans, people who are really, we have a scientific way to measure it based on Oxford UNDP framework called the multidimensional poverty index. So we actually scientifically rank them and quickly give them admission. The idea is the best education goes to the poorest of the families. And of course, we have a very robust way to do this. And these are the kind of households from where these kids come. And in about 2 years' time, we've been able to actually make them state toppers. They've got jobs with some of the top healthcare providers in India, like Apollo. So fundamentally, what's happening is that we are attacking healthcare deprivation by actually deepening the uptake from families which are typically excluded from the healthcare network. And if the nurse comes from this kind of a household, it will fundamentally transform not just her, but the entire neighborhood in which she is present. So all the trainees are actually attached to public hospitals, very much like US. I've seen the facilities in both Johns Hopkins and in Bay Area. So it's very similar. But the good news here is that they're also kind of learning as part of that. And in COVID, this was a phenomenally useful tool because the state had to quickly ramp up the capacity of healthcare provision. And as you know, nurses were the main bulwark of patient care in the entire COVID 1 and 2 kind of this thing. So this was fairly helpful. And the entire piece, and this is most exciting from a business perspective, is that it's run through a skill loan model. So they get 100% loan financing, not very different from how, for example, somebody goes to Stanford School of Business or Indian Institute of Technology, gets a seat, do not have, by definition, these people don't have money to study in this institute. They get 100% loan and they get an assured job because the quality of training is fairly good. They actually kind of repay and the whole cycle continues. So that's how it works. So this is how we are kind of bringing the Ivy League spirit into vocational education in rural areas. And one of the important points I want to kind of highlight is that I think somebody spoke about getting the government and the private sector and third sector together. And we're actually a live example of doing that. This has happened purely because of convergence with the state government. We practically are a quasi-governmental entity. We actually have a not-for-profit joint enterprise with the state. So we are in some sense becoming quasi-state and taking through this non-profit public-private partnership, starting to deliver on behalf of state vocational education services, specially targeted for the poor folks, and based on and fairly high quality, best-in-class kind of setup. And this has happened because there's a fundamental alignment between the non-profit mission of the Pan IIT Alumni Foundation, which is obviously out there to kind of help the poorest of the poor, and the government, which also has a similar objective but does not have the structure and the capability, or for whatever reasons, multiple reasons, we don't have time today to go for it. But the good news is we've managed to make this happen. So we have a training capacity of about 10,000 people spread across. These blues and greens are the center. So practically every district of the state. So we are building an vocational education architecture by partnering with the government, using their capital assets, but the loan model funds the operational expenditure. So it's a win-win-win for the candidate, for the state, and for us, because each of us benefits uniquely. The state is benefiting by getting high-quality services at a no-profit, no-loss kind of a basis for them, and they only need to fund this one time. and they will do their inauguration. Of course, they get all the credit, which is very good. We are okay with that division of labor. We do all the work, they get all the credit. It's fantastic, it works. And of course, they're funding it, so they should get the credit. So that political mileage and will and political economy is important. We benefit because we have access to ready-made infrastructure. In fact, this is the kind of setup we've got across various districts. All of this infrastructure was unutilized. In fact, there's a Netflix series in India called Jamtara, which is actually one of the districts where we really have a physical center. So it's that kind of access to kind of assets which are dormant that we have, and we kind of obviously upskill them. We kind of set up the training infrastructure, training setup to kind of upgrade them to the best of the possible standards. And that's our job, that's our expertise, and we benefit because state is giving the capital for it, they're giving the hard infrastructure, and then of course we put together the model that works. Similarly, as part of COVID response, we've done a whole lot of work. We've actually set up diagnostics labs for the state. India's first PPP PPP stands for public-private partnership, where we've actually in the most tribal areas set up fairly high-quality, state-of-art laboratories with similar tech that I'm sure is used either in Stanford or at least in other parts of the world, like in Middle East, for example, in India. And so we get all of these guys, and we have a negative air pressure room, a PSL3 kind of facility. So this has enabled the state to actually quickly, at lowest per capita OPEX cost, enhance testing, and about 65% of state testing capacity comes through this. Similarly, we've done upgradation of the Apex Hospital in one of the states. Incidentally, this is Stryker, which is a familiar name I'm sure you have of the kind of this thing. So the idea is that the poorest folks should get the best in class kind of a service, and that mindset has to be there. Just because we are catering to the poor does not mean the quality of what we deliver is poor. In fact, if anything, it needs to be better and probably best in class, because they've had a disadvantage to start with, right? So that the disadvantage has to be made up so that they can be, functioning well with everybody else. And of course, with support from the Gates Foundation, we've actually done a whole lot of training for COVID lab technicians who are in the public healthcare system. So I think I just wanted to kind of finish it at the 12-minute mark with a very interesting statement. We all know the DC world and the Marvel Cinematic Universe, but the real superheroes are the frontline workers, especially nurses and doctors, of course. And we should take this opportunity to build capacity for them. In India, it's a very, very unique moment. COVID has taught us how inadequate it is. While we will invest in the hardware, it's equally important we invest in the human capital where that kind of keeps it going. And we honestly believe that investment in vocational education, especially in healthcare, can actually both be a prescription for lives and livelihoods, which are in India, it's been a conflict, especially with lockdowns as in COVID, as lives versus livelihoods. But that conundrum can be addressed very beautifully with the healthcare livelihood piece. We've seen actually girls become breadwinners and have 8x kind of multiple in their incomes pre and post program. So it kind of transforms the family. It helps the healthcare agenda. So it's a win-win from all fronts. So this is a small case study which I just wanted to share from the ground. And that's it from my side. Any questions I'm happy to take whenever the Q&A is on. That's it from my side. Thank you again for giving the opportunity, both to Sunny, Sundar, and Don. And over to you, Don. And thanks to you.
Thank you, Kalyan. Yeah, if you could take your screen down, thank you. Very interesting and very important. We will have a question and answer session towards the end. So let's move on to Dr. Kristina Hesbol. And Kristina, I will leave it to you.
Thank you very much. Good morning. It's wonderful to be able to be here with colleagues this morning, and I'm delighted to join you today. Special thanks to Dr. Barr as well, and I appreciate the gracious invitation. I am a first-generation college student who grew up in a rural community, and so I'm going to share some background information and research today about rural education in the U.S., as well as several promising bright spots in rural America. There are more students attending American rural schools than all the students in New York, Los Angeles, Chicago, and the next 85 largest school districts combined. Nearly 9.3 million children in the US attend a rural school, nearly 1 in 5. In 23 states, a majority of rural students are from economically under-resourced families. They're less likely to pass AP courses and qualify for college credit than non-rural peers, and they're less likely to attend and complete college. With geographic, cultural, and professional educator isolation, the successful diffusion of deeper learning practices in rural schools presents significant equity and systemic challenges. And yet rural schools and the communities that they serve continue to be overlooked by researchers of inclusive education and innovative national school reform. Despite these numbers, rural schools are seldom included in discussions about American education, research, or policy. Such a metrocentric perspective disregards the educational and social and emotional needs of rural students and their communities. Reform efforts have historically been designed to address urban and suburban challenges, and place-based challenges, which are unique to rural schools, are typically absent in rural policy discussions. So most educational reforms and their large-scale interventions that are developed for non-rural contexts have limited transferability to rural regions, due in great part to their inherent spatial inequity. So as we imagine a new world on the other side of the COVID-19 pandemic, we collectively have a unique opportunity to reinvent American educational processes and programs in rural places, grounded in issues of equitable opportunity and possibility for every student. So to provide a brief background, the data that I'm going to share with you may seem like it's coming from a deficit mindset, but it's not. It's simply data. Rural communities continue to have disproportionately larger numbers of new cases of COVID, even 18 months into the pandemic. Last week, rural deaths in the US were at the highest level since March in rural spaces, while the case count fell in metropolitan counties. The weekly death rate was 117% higher in rural areas than in urban areas last week, and the infection rate was 60% higher. 97% of rural counties across the country are in the red zone. The global pandemic exposed a significant gap in educator preparation and training for online teaching, which could potentially ensure continuity of distance learning for students. That assumes that in the case of rural communities, however, all rural families have access to broadband, and each student has a device with which to connect to the internet. Both of these assumptions are foundationally flawed. The COVID-19 pandemic has disproportionately ravaged rural America. It hit rural communities hard for several reasons, including the recent closure of rural hospitals. It disproportionately impacted rural students, particularly due to limited access to broadband. The lack of adequate technology tools creates a barrier to engagement in virtual classrooms. In some households, multiple family members have to share one device, which is often a phone. 5 people in the family trying to share one smartphone, however, is not really access. The pandemic created particular challenges for students who are transitional bilingual students, needing specialized instruction to continue learning both English and core content. Students with special needs frequently had the related services that they need disrupted, to which they are entitled by law, as detailed in their individual education plans. Despite the fact that rural communities have traditionally been populated by predominantly white, native English-speaking families for generations, there is significantly increasing racial, cultural, and linguistic diversity among US rural areas. Since 1980, 95% of rural counties have seen growth in minority populations, as shown in the slide. In 40% of these counties, rural population decline slowed or reversed due to minority population growth, and this growth slowed the decline of many of the most challenged rural places. Growing minority populations bring economic vitality, social and cultural diversity, and youth into many otherwise shrinking and aging rural communities. These rapid changes call for innovative strategies to support rural educational leaders to improve learning equitably for every child. Rural communities are known for their resilience. Their small size can support nimble change. One of the frequently reported strengths of rural communities are close-knit relationships and a culture of communal responsibility. A smaller school staff can mean more autonomy with potential for leadership opportunities. Place-based learning, grounded in students' cultural background and informed by local history and resources, has been shown to be an effective framework to revitalize rural education. Equity-focused rural leaders identify and challenge practices that marginalize students, and they create schools that adeptly respond to the educational, social, and cultural needs of every student in their community. They interrogate barriers to equitable practice, and they question narratives that justify exclusionary practices. So I'm pleased to highlight several innovative bright spots in the midst of those difficult challenges. Rural school districts faced particularly difficult challenges early in the pandemic, trying to have regular check-ins virtually between students and their teachers. Tapping into their resilient, innovative spirit, many rural districts had a school bus deliver meals and learning packets to a central location somewhere in town. That same bus, outfitted with a router, parked in a Walmart parking lot so families could access a wireless signal to do schoolwork. In Colorado Springs, Colorado, 2 teachers learned that their emerging bilingual students had outdated or no technology, and few had Wi-Fi access. When this couple learned that 30 of their K-3 students had no technology access at all, they used their first stimulus check in April of 2020 to purchase Kindles for every one of their students. One of these teachers programmed each device, and when he delivered them to their homes, he showed the families how to use them, wearing masks. Some of these families speak Mam or Punjabi, but he figured ways to communicate with the family members. And these tablets made it possible for their students to participate in online learning rather than having to wait until students returned to the classroom in August. With these new tablets, the students explored sites and played engaging games and connected with their friends during the summer. I'm proud to announce the launch this fall of CIRCLE, the Center for Innovative Rural Collaboration for Leadership Education, the first rural center that's been awarded by the University Council for Educational Administration. CIRCLE will amplify rural voices, disrupt deficit rural stereotypes through innovative rural leadership training, and disseminate partnership results. It will serve as a national clearinghouse for practice research partnerships, focused specifically on improving the preparation and practice of educational leaders in rural spaces, and thereby improving equitable learning outcomes for rural students across the country. A foundational focus will be on disrupting inequity. Our model differs from traditional research practice partnerships in 2 critical ways. First, we situate practitioners as more than passive recipients of university research. District or school site staff and the research faculty will collaboratively design continuous inquiry cycles at the core of the partnership. While universities are better positioned to do select measurement and analytic tasks, the research and practice partners interpret collaboratively, resulting in joint ownership of any conclusions and next step decisions. Second, our RPP model makes an explicit connection to a teaching and learning mission in addition to research. Universities tend to be reflective partners to the practice sites. Collaboration among a variety of practitioners and researchers from multiple disciplines and contexts serves as faculty development and integrates expertise not traditionally connected with ongoing applied research. Through CIRCLE, rural educational leaders will have access to the same exemplary models of leadership that improve teaching and learning in urban schools, but this time uniquely adapted to meet the context-specific needs of rural and remote school and district educational leaders. CIRCLE plans to develop a 3rd space where rural educational teams and the university research partners will engage to disrupt rural educational inequities and thereby developing an innovative and coordinated rural professional learning network. We propose to capture, refine, and disseminate evidence collection and analysis tools, technical assistance and research, and collaboration supports. We will study whether and how those translate for use in distributed rural communities of practice, and we will create a space in which rural educational leaders and their university partners can learn from each other, the evolving open source suite of data tools derived from other collaborative work as well. I want to tell you about Red Wing Ignite as a bright spot. Red Wing Ignite is a model innovation center in Red Wing, Minnesota that offers startups for 15 to 18-year-olds, paid internships at local agribusiness and advanced manufacturing businesses, and builds a regional talent pool in the process. Founded by the community of Red Wing back in 2013 with the support of local foundations and the city, it created a unique ecosystem to share ideas and promote regional economic development. A loosely coupled structure known as a networked improvement community has been shown to accelerate the improvement of leadership, teaching, and student learning outcomes. NICs, network improvement communities, are known as NICs, and NICs provide opportunities for productively organizing diverse expertise needed to solve complex and persistent educational problems. Collaboration among NIC members also accelerates the formation of social capital that encourages the spread of innovation from one NIC member to another. In 2018, we launched the Rural Innovative School Leadership Networked Improvement Community, known as the RISL-NIC, RISL-NIC, a practice research partnership between rural school district leaders and university research partners. This NIC teaches rural participants in 43 states how to use improvement science to focus systematically and iteratively on problems of practice using inquiry cycles. It provides a platform for rural leaders to discuss candidly what's working and what's not, supported by research thought partners who help them to examine and analyze local data to inform improvement of student learning outcomes. The university partners provide coaching and technical assistance to provide peer learning among their practitioner partners, and we acknowledge that it's the practitioners who are actually the experts. So while this NIC model shares some principles and strategies with other popular school reform efforts, in its fully realized form, it represents a significant departure from the way that school improvement efforts have traditionally been approached. This innovative reform strategy is no cost, it's just-in-time professional development. The problem of practice is specifically place-based, and participants become affinity group collaborators with others who have comparable challenges. The NIC strategically builds partnerships in responsive, rigorous ways to improve instructional strategies that meet increasingly diverse student learning needs. It develops synergistic opportunities for rural educational leaders who have previously been very isolated, and it helps to create what Duncan Andrade calls critical hope. This is the RISL-NIC is an innovative practice research partnership, and there's emergent data coming from one of the participating sites in South Carolina that suggests that the RISL-NIC is an effective tool to leverage change in high poverty rural schools, and it's well suited to the challenges presented by rural spatial inequity. Eliminating deficit mindsets and supporting diverse students' funds of knowledge and community cultural wealth are requisite leadership responsibilities necessary to guide schools and districts that genuinely welcome all students and families. As communities in the rural West continue to diversify, it will be particularly critical for leaders to be prepared to be culturally responsive to meet students' needs. Yoso's cultural wealth model includes 6 types of capital that educational leaders can use to frame their interactions with students. Rural communities tend to be rich with social capital, with strong relational networks with others who live and work in the same community. Seeking to understand the community cultural wealth and funds of knowledge of new rural community members, we want to understand that rather than to reproduce the power of competing narratives. This will support a shared vision for systemic improvement throughout rural communities. There are many recommendations that we could spend hours on, but the aforementioned challenges need to really be addressed by a complex policy network with which ubiquitous internet access created by a national broadband network is considered a utility comparable to water or electricity. For decades, researchers have asserted that educators have been ill-prepared to teach with technology. The systemic lack of preparation, training, and support that rural teachers had in order to design quality instruction with technology created additional stressors to teaching and learning remotely, particularly during the early parts of the pandemic. Creating a national rural opportunity administration would be a paradigmatic policy shift in which state infrastructure, rural economic development, and innovation would be widely supported. Small business incubators similar to Red Wing Ignite and the Center on Rural Innovation need to be a foundational component of education, business, community partnerships around rural America. Building capacity and resilient communities is an assets-based approach to rural development. Purposeful inclusion of diverse community members in decisions that impact their families is critically important. So the coronavirus pandemic has shown us that during a crisis, the key alternative to attending school is online learning platforms. Bridging the digital divide in tomorrow's post-COVID era calls for governments and development partners to invest in increasing access to broadband, to electricity, and to solar power in rural areas, to retrain teachers and leaders in innovative strategies, to develop online learning material and digital resources, to invest in telecommunication infrastructure and building systems with strong offline functionality as well. It's time for this country to make a meaningful commitment to rural America, to provide vibrant, sustainable local economies with high quality jobs, as they do at Red Wing, and to foster economic growth and vitality to attract innovative and entrepreneurial people to live and stay in rural communities. The innovation and determination in Circle and in the Rizzlenick hold great promise to reimagine the future of rural America. At Circle, we're committed to shifting the narrative and broadening the conversation about what's possible in small towns and communities. We plan to discover what the edges of our field are and how to push them. Circle fellows, who will be rural practitioner partners as well as researchers, will amplify rural voices, working with rural communities, talking with and listening to rural residents. We look forward to synergistic collaboration with other agencies and institutes that share our interests in innovative and equitable rural educational and community leadership to advance our work in pursuit of rural equity and opportunity for every person. Rural students have the same right to high quality, best practice instruction and social and emotional learning as their non-rural peers. It is in fact their civil right, one that can be increasingly realized as we cross-pollinate our sectors to disrupt rural inequity through innovative and collaborative rural leadership training. Thank you.
Thank you very much, Dr. Hesbol. That's such a critically important issue, and I know the whole issue of the transition to digital learning and is so essential. Let's move on to Professor Ann Lopez from University of Toronto, and have Dr. Lopez's presentation. Thank you, Dr. Lopez.
Thank you. Have I unmuted myself? Awesome. Thank you so much. Hope you can see my slides here. Okay, wonderful. So first of all, I'm coming to you from Ontario, Canada, and I am going to be sharing a little bit of a land acknowledgement. That's what we do here in Canada. Today, September 30th, is Truth and Reconciliation Day, which means we acknowledge here in Canada that we are on the land of Indigenous peoples. And that is so very, very important. So I wanted to acknowledge that. So I'm going to be talking a little bit today to you about leveraging sort of the knowledge that we get from the pandemic and how we can use that to challenge inequities in education. And before I do that, I really wanted to say that as I was listening this morning to some of the presentations, how much the work that I'm doing really overlaps with the work of the Ideal Village and the goals and the outcomes of the organization, this conference. And I would really want to thank Professor Sunny and Anand and their team for inviting me to this conference. Some of you might know, as you maybe can hear, I am from Jamaica. I am Jamaican Canadian. And with that, of course, is part of my identity. What happens in what I call low-resourced communities is really important to the work that I do as an educator. My focus will be a little bit more pedagogical in terms of strategies and ideas around teaching and learning and leadership. And hopefully, as we sort of think about this pandemic, think about what we do as we journey through it. What are some of the practices that we can change, that we can engage in, and that we can rethink and really ask different questions? I also have been engaging in research in Jamaica, as I've mentioned, and in Kenya, here in the GTA. And I'm also now going on to Ghana next year to do research with school leaders and really to find out how can we use the local knowledge to inform teaching and learning and leadership. And I think one of the presenters this morning was mentioning how important it is to have community voice as we begin to reconstruct, reimagine what happens post-pandemic. So I wanted to frame the conversation and to frame my ideas and to frame the thoughts I'm going to be sharing with you, to draw you in to this dialogue and conversation with me. And so we've all seen in many ways how the pandemic has laid bare structural inequities that were already there. And so many of these inequities, of course, in education, in healthcare, in resources to support good quality life, really these structural inequities were there, as we've been hearing throughout this conference, and all of the folks who have been sort of engaging in different strategies to support communities. And so I think what the pandemic did, by highlighting this reality that maybe we didn't pay enough attention to, whether it was in India, South Africa, Jamaica, parts of Canada, rural Ontario, all of these spaces, really what the pandemic has done, it has now forced us to ask new questions. It has forced us to examine what are some of the new possibilities, what are some of the things that we should be shedding light on. And Dr. Hesbol, thank you for your presentation in that way in terms of the circle, that you're going to be starting up the organization that will foreground leadership in rural contexts and some of the initiatives that you're talking about, as well as we heard and saw where healthcare is going to rural communities. So I think it's so very important that we begin to reimagine some of these issues as we think about challenging those inequities that many of our speakers have addressed and talked about this morning. And so as we do that, I wanted to sort of articulate some of my thinking around some of the questions that we might want to ask as we think about post-pandemic. And I'm really kind of torn with the word post-pandemic because we're still going through it. But however, whenever we get back to a state where we can be in community and we can gather, maybe that's kind of a signal. So to all of those who are listening, to all of our participants who have taken time to join us, may I ask you to think of some of these questions? And the first one is, how can educational processes and practices be reimagined? So think about this question in your own context, whether you're in India, whether you're in the United States, North America, Canada, whether you're in other parts of the world, other parts of Asia. Maybe we have participants from Australia and so on, where we know we have large indigenous communities. And let us not forget our indigenous communities in all of the work that we're doing. Begin to think about what are some of those educational processes that need to be reimagined? And really, again, also, how can inequities and disparities that persist in communities be addressed? I think we're beginning to answer that one in some of the presentations that we've seen this morning around healthcare and rural education and all of those things. That what I really like about the ideal village that impact the whole person, I really enjoy the interplay that is foregrounded in the goals of the ideal village. It's about health. It's about education. It's about well-being, this holistic approach. And so begin to think about what are the implications of this inquiry for educators and education, which means the research that we do, how we teach, the curriculum, and all of that. And of course, I'm going to focus a little bit this morning then on one of the key aspects that have emerged during the pandemic. And I think Dr. Hesbol really articulated in many ways some of those issues around the role of technology or e-learning or teleeducation, as some people call it. And really, during the pandemic, in many spaces, in many communities, parents and students had to rely on technology. So the questions that we need to ask as we're moving forward, using the knowledge that we have gained and to move forward, we really now need to begin to ask some very important questions about what might e-learning look like? How will it change? How can it change? How do we identify the inequities? And what do we do about it? And what I like about many of our speakers and this conference is the praxis, is that connection of ideas into action. And I think Dr. Hesbol so wonderfully already framed some of the possibilities around alternative leadership paradigms in the organizations that she's starting, and as well as the questions that she posited that we should begin to ask. So let me focus a little bit on e-learning or e-technology. And I want to put this in two ways. And it's really to look at the possibilities, because I think Dr. Hesbol talked about Dr. Andrade's notion of critical hope. And the work in the ideal village is about hope. It is about lifting up. It is about doing more than surviving. It is about thriving for all communities. And so as we talk about the challenges, it is so important for us to frame this within a framing of hope and possibilities, because that's where we get the energy. That's where we get the energy. And so as I begin to share some of the possibilities for teleeducation, I think it really plays a role for continued learning for many students. Some now have termed this learning loss. It's a contested term. I do not have time now to go through why many educators, for example, myself as a critical educator who focus anti-racist paradigms and challenge inequities, why we sort of think that term is contested. But nonetheless, I think teleeducation really, during the pandemic, we have seen the potential. We have seen the possibilities for creating greater equity in teaching and learning, because it has created greater access. We can talk about the access is not homogeneous. It's not a monolith. There are different ways and different kinds of access. And so it created possibilities as well. And this was not just for students in low resource communities. And I'm using the term low resource intentionally as we seek to move away from terms like underprivileged, poor, all of these. No student want to go to school and say, I'm from the underprivileged group or the disadvantaged group. Students need affirming language. So some of us critical educators are working to change and to have those affirming language. So now we speak of low resourced communities. And so in addition to that, what the pandemic has shown us is that teleeducation is also serving the needs of students who might not necessarily be in low resource communities, but who learn differently, who might not like the largeness of some classrooms. Here in Ontario, you could find 30 students in a class. I know in some of the areas in rural communities and in other parts of the world, classrooms are really huge, and which affects the learning of some students. So I think what the pandemic has done for us is to help us to really think deeper, take that, what we call that deeper dive, to take that deeper dive into the possibilities of teleeducation. And so again, we talk here in Ontario, some families from racialized communities really talked about this idea of safety from racism that teleeducation afforded their children, not to be in spaces where their soul and their spirit were being harmed within the context of those classrooms. And it also Studies have shown that there were some instances of greater participation because of that, because of teleeducation. And so some students are doing better. They're achieving greater outcomes because it's a way of controlling the pace of their own learning. And so those are some of the possibilities. And we must hone them. We must keep them because the possibilities give us hope. But there are also challenges. And of course, we saw all of the research, and some of this research is ongoing around increase in mental health issues for some students due to isolation, long periods of screen time. For some students, particularly in North America and on other places as well, school is a place where some students from low resource communities get a hot meal. And of course, my own grandchildren, while they were at home during the pandemic, when I talked to them, they told me how much they missed their friends. And so these are challenges. And you know what it really does for all of us, and for myself as an educator, is really to bring to us the importance of schooling as a social good. Because oftentimes we tend to forget that schooling has these unique roles that it plays. And of course, we've all seen the research, how some parents were really unprepared to support their children in terms of knowledge and skills in their learning while they were participating in e-learning at home. Not to mention, as we talk about low resource communities, issues of home space. Do you turn on a camera? Do you allow students to turn it off? Because all of these things, if it's how many rooms are in the house, what does the space look like? How does a student get online while mom and dad or the family or extended family might need to make a meal? These are real practical issues and challenges that have emerged. So we have to think about them. It doesn't mean we get away or forget e-learning and teleeducation. It means as a collective, as a group of people, we begin to identify, we begin to name, and then we begin to collectively drawing on the knowledge of the community. That's what culturally responsive work is all about. And that's what anti-racist decolonizing education is all about. It is about valuing the knowledge that resides in the local community. And so to begin to think about how we overcome some of these challenges. And so for the purposes of all of our participants and who might want to take away some look-fors, take away some ideas from this conference, so the big question that I'm thinking, and I suggest that folks think about then, is how do educators create a framework for teleeducation that's undergirded by equity? And that's the key thing, because we cannot use teleeducation to perpetuate inequities. We cannot ignore inequities that the pandemic has really brought to the fore. And it's great to hear the conversation that has been happening. And so quickly, I just want to say that equity is not the same as equality. And that's very important for me to share, because oftentimes those two terms become a little bit confused. And so when we talk about equity, I'm talking about providing opportunities for students and removing barriers to their success in teaching and learning so that they can achieve their full potential. Equality, on the other hand, might be dividing resources equally. But when we divide resources equally, we might not be providing the opportunities that some students need to catch up based on barriers that they might have experienced in their schooling. And so that was just very important for me to say. And it's not equal treatment. And of course, the most important thing about equity as well is that it focuses on redressing disparities. And of course, it meets the needs of individual students to ensure that they have fair access to outcomes and so on. And as we've been watching some of these videos in healthcare and childcare and all of that, that's exactly equity. That's equity. We go to the communities where the resources are needed. That in itself is equity in action. And we are moving away from equity-minded to equity in action. What does it look like on the ground? And so
thank you, Dr. Lowe. We're going to need to move on fairly quickly. So if you could
okay.
Thank you.
Thank you so much. Anyway, so I have some examples to share and ideas that folks could use to, as they engage students and engage educators in some of this work. For example, as we work with students to deal with the challenges in teleeducation, that students need to be provided with timeout. Students need to have a dedicated person or counselor in the schools to work with them when they raise issues. Teachers need to be trained. There's a teacher education component as to what to look for when there might be mental health challenges. It's also important to implement policies so that students can have adequate access to broadband, computers. What might this look like, for example, in rural areas? It might be necessary to visit homes to see the kind of teaching, kind of inventory that's in the home. All of this is the groundwork. In urban areas, it might mean supporting families to access the internet. It might mean also support in communities. It might mean partnering with local community organizations to access resources and so on. And of course, it needs a plan. And so as I wrap up, community engagement is also very important. And, it's so important to hear what parents have to say, particularly in countries of the global South. It cannot be policy borrowing from the North. And so this is the framework. So teacher leadership and education is also important. I'll skip over those and go to my conclusion. Just to say that is very important for leaders in terms of doing this work, in terms of challenging inequities, to have a new paradigm, a new focus, a new way, a new concept of thinking about building relationships, thinking about notions of inclusion, professional development, the knowledge, the kind of knowledge. We cannot go into spaces with knowledge that's grounded in outside in information. And so as I wrap up, I want to say thank you for having me, and thank you for giving me the opportunity of sharing some ideas with you.
Thank you, Dr. Lopez. And I'm sorry for interrupting, but it's such essential work as you're describing. So let's move on to Robert Fung, who is the high school principal in the San Diego School District. Let's hear the perspective of a high school principal. Robert, thank you.
Thank you, Dr. Barr. I hope my screen share is working. I just want to express my thanks to Dr. Barr for your facilitation, and to Sundar and Sunny for inviting me to speak here today. It's a pleasure to be here, and certainly an honor to join a panel of such distinguished individuals. And I want to speak today from the perspective of an educator, a practitioner, a school administrator who's experienced and worked in K-12 settings through the various stages of the continuing pandemic. I also want to acknowledge that I think a lot of what I will speak to is well aligned with some of what my peers, my fellow panelists have spoken to already, so I appreciate that as well. All right, so I want to speak about several contexts that I've worked within for the past year and a half during the pandemic. So a couple of high schools where I've worked and been a school leader, Health Leadership High School in Albuquerque, New Mexico, and then San Diego Met High School where I'm currently principal. I also want to draw from my experiences working with Big Picture Learning, which is the network of small schools. San Diego Met is part of it. So I draw from some of the experiences, best practices, and challenges that Big Picture schools have been facing over the past year and a half of the pandemic. So what did we learn within these contexts? What did we learn about student needs and student learning? And what can that learning tell us about what education should look like going forward, or can look like going forward? What does it mean to be a post-pandemic educator? There are several things that I want to point out about learning, but much of it is really about student engagement. And that, I think, is my key theme today. We learned that reproducing in-person schedules virtually didn't really have the effect that we wanted. Students weren't really showing up in the way that they might have prior to the pandemic. We also learned that just changing the schedule to accommodate what we now called asynchronous learning, which is students kind of working on their assignments when they had time, checking in when they were available rather than coming to a set class time. Also office hours being offered. These were ways to acknowledge where students were coming from, but even those didn't have the impact that we wanted. We also learned in terms of engagement that students who normally would have engaged with each other in person were not really striking up conversations with each other in Zoom, even when they were in the relative privacy of a breakout room. You weren't seeing that engagement happen very easily. This is something that would be familiar to a lot of K-12 educators over the past year and a half. This is what a lot of Zooms looked like for teachers. So a lot of black screens, a lot of cameras off. Even when we were able to encourage students to turn on their cameras, what we often saw looked something like this. And on the internet, I saw this referred to as Zoom forehead syndrome, where students would turn on their cameras, but they would be only willing to show you everything from the forehead or the eyebrows up. So how do you teach online when your students don't want to turn on their cameras? This became a big question of the past year and a half while we were still in virtual learning or hybrid even. And I think that key learning for me was, we tried a lot of different experiments, and what it showed was that improving engagement was really going to be the main factor in whether students were learning. More important than curriculum, we really had to start from a place of how do we get kids to feel engaged when we couldn't bring them into the physical space anymore. And that question led to some bigger realizations, bigger than just, do they engage online? Do they engage through Zoom? Do they engage asynchronously? Bigger than that was questions that the initial and middle phases of the pandemic showed us different challenges. So I'm hoping that we are in the latter phase or the closing phase of the pandemic now. But we saw as the pandemic changed as the months went on, we were facing different challenges and about how we were going to approach how students learned. We also had some bigger realizations about grace and what it meant to meet students where they were and to accommodate their challenges. But I think the most important thing that we learned was that there was no new normal, even though that was a phrase that a lot of people started to adopt. Instead, what we saw was that we used to take for granted in-person learning as an effective paradigm for engaging students. However, what we were seeing was that was really just a paradigm that hadn't served all students well. It had served some students well. Yes, I think it's better for us to be in person, but no, just being in person doesn't mean that all students had equitable opportunities or outcomes. And when we had the chance to go back to in-person schooling this year, we didn't want to return to that kind of normal. So what did we do? Based on what I learned, I would advocate for a new paradigm of learning that I call an education ecosystem, where students, families, staff, and community members and industry partners are all collaborating as an interconnected whole, and where each member's health and success is intimately connected to the health and success of the others. To do this, we leaned into three powerful themes that had sustained our work pre-pandemic, but which really took on new and different meanings now in the new pandemic reality. Those three themes are social emotional support, personalized curriculum, and community impact. And I'll start with social emotional support, which I think is really the basis of the rest of it. So we understood, I think, that as educators, that relationships matter most, and that is the key to engagement. That's the key to keeping consistent engagement from students. What were we doing during the pandemic to maintain those relationships against the challenges of COVID? One way that we looked at it was, this is an example from an engagement tracker that we created at San Diego Met. And what we understood from this was more important than what we thought of as attendance in the conventional sense. More important than that was understanding how students actually engaged, how they were showing their learning, and how they were sharing their learning. And that could include asynchronous work. It could include site visits to the home to understand the context that they were learning within. But it really was a way of broadening how we understood what does it really mean that a student's learning? Does it just mean in the old conventional way of the student is here from 10 to 10:55, sitting in the seat? That we understood that wasn't learning. We had to redefine that. And I think engagement was the lens that we looked at for that. A second example is a cultural and linguistic responsiveness framework that we created at Health Leadership High School. This was a way to visualize how we could address equity gaps. And especially in the state of New Mexico, we are working with a highly diverse population of students, a large number of students from minoritized and marginalized backgrounds, including a large number of indigenous students, many of whom live in rural contexts and on the reservations. And so this particular diagram is a little complicated, but at its heart, this is a framework that guides educators to validate and affirm an individual's home culture and language in order to create connections in various social contexts. And I think this was especially important, you know, in Albuquerque. We're relatively fortunate in New Mexico because it's a more urban area as far as access. But we had some peer schools and peer educators at other much more rural parts of the state where having a device provided by the school was not enough. Having a Wi-Fi hotspot was not enough, because you're talking about a student who lived in a context where they had no internet access. So the device could not be connected even if you gave them one. And so I think, you know, I appreciated how Dr. Hesbol and Dr. Lopez spoke to some of these issues in the rural communities. We were facing some of that on the ground. And what did it mean about how do we support those kinds of students? Did it mean just distributing packets? I think that was an experiment we tried, but we realized what was more important was grounding their education in their local context and their community knowledge. And I think this framework helped us think more about that. And a third structure for social emotional support was the student-led conference, often referred to as SLC. This was a best practice that existed prior to the pandemic, but the way that we affirmed it during the pandemic, I think, was important, because instead of being able to count on, again, students being in person, families coming to the school, we could no longer count on that. So to embrace that background and to really include families as part of the student's education was the goal of what we were doing virtually. And when we couldn't do it virtually, it might have meant doing home visits and meeting with families outdoors to continue safely, to still build those relationships with students and families, and to, again, maintain an engagement level that had really diminished at the beginning of the pandemic in the initial phases and was threatening to continue to stay low if we didn't do more work that was student-centered, family-centered, and really put our money where our mouths were when it comes to being a community-based school. My second theme is curriculum in terms of personalizing curriculum for student experience. One area where we had already had some success prior to the pandemic was at Health Leadership High School was our senior capstone project. This was a sort of initial attempt to personalize project-based learning to an individual student and allow them to design a year-long project where they could have an impact on a community that they understood and that was important to them, or a cause that was important to them. What changed in the pandemic was we realized that this was possible and valuable, not just for a senior, a 12th grader, but for all students. And when we were having limited access to students in terms of them being in a classroom environment, even a virtual environment, all listening to the same instruction, it became that much more important to go into the students' context, community, and what they understood, their own funds of knowledge, and to start using that as a source of the curriculum rather than the content. So the student was the curriculum, not the content, and that's what personalization meant. This image is an excerpt, an example of one student project on the topic of mental health awareness. This was a topic that was important to this student and affected her community directly. And I think from that, you were getting more authentic student work that wasn't limited to the teacher's knowledge, wasn't limited to school knowledge, but really drew on the knowledge and the values that that student was bringing to her education. A second example of personalizing curriculum was an experiment that we called X-Block at Health Leadership, and at San Diego Met, we called it Labs. These were an experiment that really recognized that learning can and does happen in many different ways. And we wanted to start honoring those different ways by dedicating time in our schedule for things like workshops, panel discussions, and other experiential learning experiences that students themselves and staff were interested in, but that did not neatly fit into what we thought of as curriculum prior to the pandemic. The limitations of the pandemic actually became opportunities for us to rethink what we wanted students to experience and learn in a virtual or in-person classroom. And so this image is a list of some examples of X blocks that we had with some descriptions and how frequently they were offered. Many of these being opportunities for students to lead learning for their peers and not just having it teacher directed entirely as prior curriculum had been. And my third theme is community impact. We truly believe in big picture learning, as well as in small school settings that are innovative like health leadership, that students are agents of change who can make positive impact on their communities. I think this is a truth that I try to empower through the work that my teachers are doing with their students. And as a school administrator, I see it as one of the primary goals of my work is to build in pathways to employability, pathways for students to make an impact in their community, pathways for students to have options after they leave my school. This image shows how we built in industry recognized certifications into our curricular framework and schedule. An industry certification in a health context at health leadership were certifications that allowed students to have the opportunity to get a paying job either during or after high school. So it was a pathway to employability. When we left it to chance or to students opting in, it was kind of reinforcing this idea of those students who are already predisposed to take advantage of certain opportunities are getting those opportunities. And that's not an equitable outcome. And so instead of making it an optional extra, we built them into our curriculum so that every student had the benefit of those certification opportunities. And it was built into the time that they were already spending with us in school. Again, in the pandemic environment, it was about reaching out to make sure every student was connected to these opportunities. When we come back to an full in-person environment, which some of us already have, most of us already have, it is about maintaining that belief that every student should have access to these opportunities. And then in terms of other pathways to employment, I'm a firm believer in internships. The big picture learning model is an internship and interest-based model where every student has the opportunity to spend several days a week working at a real world work site. Dual enrollment and early college access is another real world learning experience that gives students that chance while they're in high school to be engaged in opportunities that exist outside of high school. So this excerpt is an apprenticeship learning plan that we had designed that starts the conversation about what are some parameters for a student learning in an internship or apprenticeship. What are the kind of competencies that a student would have to identify with the mentor at that site? And it gives, again, that chance for students to kind of drive their own learning and be agents of change and agents of equity in their own communities by connecting with mentors and building their own social capital in their communities that they value. So I'll close with some thoughts about recommendations and where do we go from here. I think that the pandemic reinforced ideas that we already had about student-centeredness that we already knew were important, but that we hadn't really fully explored or fully taken advantage of for every student prior to the pandemic. And now we were in a space where we really had to do that in order to even capture every student in their engagement. We started to look at equity in terms of when we say meeting students where they are, where they come from, and also where they want to go, that was really about centering our work, again, in community knowledge, including families as part of the work. At San Diego Met High School, where I'm currently the administrator, we say we don't enroll students, we enroll families. And that is not just marketing speak, but that is a reality that we try to make happen every day with our students. Also facilitating student interest through the lens of content, so that it's not curriculum divorced from student interest and background in terms of, especially Eurocentric curriculum, or sometimes we understand that students struggle in math because a lot of students don't see themselves as math learners or as being good at math. It is asking those questions about what does math have to say to this student and what they care about in their community? Or what do the social sciences have to say to this student who wants to make an impact on opioid epidemic in their community or some other challenge in their community? What do these content areas have to say to that student, that's where I think you have an access point for those students to deepen their understanding of the content, because they want to apply it to their community context. And so making learning experiences relevant not just to the student, but the educators and community speaks to what I see as that ecosystem model again, of all the players in this community being deeply interconnected in the goals of the community, starting primarily, of course, with the students who are trying to make their way in the community and understand their role among the other social connections that they have. And so I think in order to pursue that ecosystem model of education, the post-pandemic educator is someone who builds meaningful relationships with students, supports them in designing personalized learning experiences and projects, and connects them with the opportunities, mentorship, and the ingredients of social capital in the real world, so that every student is the beneficiary of meaningful options that they are well prepared to pursue after high school.
Great, thank you very much. No, thank you very much, Robert. Again, essential work. I'm afraid that we're not going to have time for a lot of question and answer, although there is one question. There are a couple of questions in the question and answer that they're similar, and I'm going to actually pose it to Dr. Lopez, and then let's see if the others want to talk about it, which is knowing how when children are in screen time at home, it's often entertainment, whereas when they're looking at a teacher rather than a screen, it's an entirely different experience. What do we know about the learning efficacy of students who are looking at a screen rather than a person, particularly the students from disadvantaged backgrounds? Dr. Lopez, is there something you can say about that?
Sure. And again, I'm just going to disrupt that language of disadvantaged backgrounds. Again, we try to use affirming language and not deficit lens. So we say students from low resource backgrounds, emerging learners, we can find any term that we choose to use. The second piece to that question, though, is one of pedagogy. And so I think really when it comes to looking at a screen, really what teachers can do right now, and some are doing, is actually using some of the methods within those games and other things the students use when they're not in formal learning. Remember, schooling is formal learning. Students also learn informally. And so it's really about how the teachers use some of those strategies to engage the students while they're looking at the screen. Now, when it comes to screen time specifically, yes, there's a lot of research that says it's not good for students. It has to be monitored. It has to be a certain amount of time. And particularly, we've heard anecdotes and narratives from some parents that it even leads to behavioral issues because some students just have a hard time just looking at a screen for so long. So yes, and you know, the last thing I'm going to say on that, in the interest of time, teaching and learning is dialogic. We need to be in community. Teleeducation is supports that, but it doesn't replace just face-to-face teaching where we can engage personally. So yes, screen time, it's not necessarily good for students, so we have to monitor that.
Well, thank you very much. I think we're going to need to pass it off to the next panel. So Sunny, I will return to you and let you take it from here. Thank you, Kalyan, Robert, and also Kristina, who had to sign off. I found your talks very informative. Thank you.
Thank you, Dr. Barr.
Thank you. Thank you.
Thank you.
Dr. Barr, and all of our wonderful speakers from the education session. It is my great privilege and pleasure to welcome the session for session chair for water and sanitation. So this will be chaired by Stuart Rudick. Stuart is the founding partner for Mindfull Investors venture fund, and he's been a top performing investment manager for the last 3 decades, but particularly focused on social capital, social investing, and so on. And per his request, I ask all participants, panelists, to have a glass of water in their hand. So over to you, Stuart. Thank you very much.
Thank you. And good day, good evening, good morning. As many of you can see, I'm in a place where the sun has just risen, and that's in Kauai, Hawaii. And it happens to be the wettest place on the planet. So I'm very grateful to be in this sacred land and the sacred water, and to facilitate this esteemed panel for us to talk about water and sanitation issues around the globe, which, as many of you are acutely aware of, is really the #1 issue for water in the world, with 2.5 billion people in the world not having sanitation, clean toilets, and sinks to use in their lives. So we're going to start off with a little toast. So if you all have a glass of water, if you can hold your water up, and if we just take a moment and take a deep breath together. We all know water is life and water is sacred. Yet the challenges today are that water is not valued. It's undervalued, and it is time for us to value water. So as we hold this water, knowing that it is the sustainer and the giver of life, let's say deep gratitude to this water and thanks for all that it gives to us and how it provides generously to us. And may we respect water. May we respect her. She is feminine, but she's the embodiment of masculine and feminine, and the unity of masculine and feminine. And may this water unite us throughout the entire globe and bring us together, so we may see that we're all in this life together. And may we have compassion and love towards everyone and every species on this planet, with water uniting us all. Cheers.
Cheers. Cheers.
Lovely. Lovely, lovely. Okay, so we are going to start the panel off, and the way that I am going to be introducing everyone will be in their order of speaking. And just as Sunny had shared with you, I've been in the investment business for 40 years, investing in innovative companies and technologies, and water has been an area of focus and passion for me. And 5 years ago, I committed to really dedicate the rest of my life to water innovations and water solutions. And I am focused on finding entrepreneurs around the globe that are passionate about creating water innovations that will truly solve the challenges that exist. And I believe it will be done, and it'll be done with, first and foremost, people. And secondly, it'll be done with the capital that will come to support brilliant entrepreneurs that are coming up with these solutions. And so our panel has esteemed people that are working on these solutions, that we're excited to have them share their thoughts. And we're going to make this be a active and engaged time for us to talk with each other and talk together. And we welcome you to be asking questions and for you to participate with us in this, because we're doing this for you and for us to engage with each other. Our first speaker will be Mahesh Babu, who is managing partner of Scale and Sustainability Associates. Mahesh has been a pioneer in sustainable waste management, creating the virtuous circular economy models over the last 20 years. He has contributed to significant industry policy and implemented over 30 wastewater projects, building relationships with regulators and businesses, and following the highest governance standards. Babu is chairman of the Waste Association of India and headed the Environmental Committee and Federation of Indian Chambers and Commerce Industry. And he has a master's in international relations from Johns Hopkins and a postgraduate management degree from XLRI in India. Our next speaker will be Guru Raj Desh Deshpande. Dr. Deshpande goes by Desh. He is the president and chairman of the Sparta Group, and he was the founder of Cascade Communications and Sycamore Networks, which are two extraordinarily successful and truly innovative, transformative companies in the telecom industry. Desh is a lifetime member of the MIT Corporation He and his wife started the Deshpande Foundation, which supports social entrepreneurship and provides funding grants to significant organizations for innovation, including MIT and NSF Innovation Corps. Desh has a B.Tech from Indian Institute of Technology in Madras. He has an ME from the University of New Brunswick, Canada, and a doctorate from Queen's University in Canada. He is co-chair of the National Council to support President Obama's Innovation and Entrepreneurship Strategy from 2010 to 2015. And he and his wife's foundation are extremely influential in supporting innovations in all areas relating to water and improving our health of our climate and the youth. And finally, my dear friend, Rachel Cardone, who is Deputy Director of the Water and Health Development Woods Institute in Stanford. Rachel spent over 20 years working in the water sector with a focus on water and sanitation services in low and middle income communities. Her area of expertise is in sector financing and investment, as well as organizational development. And she has deep experience working with public, private, and nonprofit groups relating to risk assessment, program design, measurement evaluation, and learning frameworks with a focus in the area of water and sanitation hygiene. Prior to her work with the Water, Health, and Development, Rachel worked as the founding member of the Water, Sanitation, and Hygiene Program at the Bill and Melinda Gates Foundation. Rachel has a BA from the University of Michigan, and she has a Master of Public Administration from Columbia University. We are grateful to have her here joining us and to be part of our esteemed panel. I believe that's it, correct? Is Bahaj going to join us?
No, that's it.
Balaji, yes?
Balaji is in the next session, sir.
Okay, thank you for that clarification. So we're going to kick it off and start with Mahesh to share your insights on water and sanitation hygiene. Take it away, Mahesh.
Thank you, Stuart. Firstly, I'd like to thank you, and also to thank you for both the introduction and the wonderful toast. I also take a minute to thank the Wheels Foundation and Stanford University for organizing this conference and giving me an opportunity to share some of my learnings in my career in solid waste management.
Are you going to share your slides, Mahesh?
Yeah, I'm just trying to get it done. If you could give me a minute. Lower that.
So while we're waiting, I've seen one comment in the chat area. If anyone else has any comments or initial questions, please share them. As we've said, we really want to make this interactive with your engagement and to serve your interests and your needs so we can all support water and sanitation hygiene. Mahesh, do you need any help getting your presentation to come up?
So we have it on our computers at the Zoom admin. If you want, we can play it from the backup.
Would you like that, Mahesh? Would you like us to do that for you, please? You're on mute, Mahesh.
Can you see it now? I put it on. No? Okay. Then maybe, Sunny, if you could share it from the... Yeah.
Full screen, please.
So, yeah, can you see it?
Yeah.
Yes, we can see it.
Okay. So, firstly, thank you, Stuart, and we can go to the next slide. The point that I wanted to start off with is slightly on a dismal note, in the sense that most of the developing world has dump sites, open dump sites for dumping our waste. Unfortunately, you have Deonar in Mumbai, for instance, which generates about, Mumbai generates about 11,000 tons per day. And then you have, can you move on? Mandur in Bangalore, again, another large dump site. And then please move on. And then you have Chennai again, which is another city. So this is the typical scenario that you will see in most of the cities in the developing world, unfortunately. Close to about 80% of the waste is basically unprocessed and gets, basically waste is dumped instead of being processed. So that is one big issue which cuts across, I think, most of the developing world. It's not only the cities in India, but much of the developing world as well. Yeah. Please continue. The situation is only going to become worse with time, because as, for instance, in India, we are going to have 600 million people by the year 2030. Right now, we are at 70 million tons of waste, and this is likely to go up to about 160 million tons. And so there's a huge pressure, in some sense, on ensuring that we stop dumping waste in open dump sites. There are also regulations in place now, which are unfortunately not enforced sufficiently. And so there's a public demand that is growing along with a more active judiciary. You also have this another confluencing factor, which is global capital being earmarked for environmental and social and good governance. So this will be a big driver going forward. So I think now is really the time to make a difference in this space. And I think that's why I think it's a very topical point, especially in the pandemic world as well. There is a growing private equity interest in the waste business itself, so it gives organized business also an opportunity to really take this forward. Next, please. The solutions, next, please. The solutions that we devised for Delhi basically was an integrated waste management facilities that we set up. If you divide waste into three broad components, that is combustible waste, which you can convert to energy. Then there is what we call construction and demolition waste, which you can convert again to useful products. And there's always a demand for construction in the developing world. And then you have organic biodegradable waste, which you can convert to organic fertilizer, compost, what we call compost. So Delhi generates about 10,000 tons of waste, and we managed to provide solutions for about 5,000 tons. It is not that it's all been achieved. Delhi still has a long way to go, but these facilities really helped in bringing down the particulate matter and the air pollution in the city itself. Yes, please. Next, please. Construction and demolition waste. This is what we pioneered in some sense. And I just want to make a point here very quickly that, this facility did not exist. It happened during the Commonwealth Games in 2009 when Delhi was struggling to find a place for the waste that was being generated. The city was generating about 3,000 tons every day, and most of it was being dumped in eco-sensitive areas like the Yamuna and the Ridge. So there was a big, gap from that point of view. And then we stepped in and we set up these facilities. And actually, based on these facilities, the regulations came into force. The point I'm trying to make is that regulations in itself is never sufficient, especially in countries like ours. And unless it is backed up with a managerial solution, it becomes difficult to actually enforce. And I think we are one of the most regulated countries in the world. But in terms of actual implementation of ground, there still is a big gap. And that partially is because I think in these kind of spaces, like for instance, Bangalore is the tech city of the world, and yet we struggle with things like, waste management. So unless we build scalable solutions in these cities, this problem will, become worse as we urbanize. Next, please. So what we did with construction and demolition waste, we processed about 6 million tons of construction waste, which would have otherwise ended up in the Yamuna River or in the eco-sensitive parts of Delhi. And it's a major contributor to our water bodies getting inundated with waste as well. And every city in India really requires a facility of this kind. And it can recycle up to 95% of the waste. And even the makeup water which is used is from treated sewage water. So it really, in some sense, is almost like a zero waste discharge facility. Next, please. These are some of the products that we make. It includes, recycled aggregates, manufactured sand, which again is a big, there's an angle to manufactured sand, because if you do not get sufficient manufactured sand, then what happens is you have sand mafias who basically get the sand by illegal mining of river bodies. And as a consequence of which, again, this has an impact on water. So you can see the synergies here between, proper waste management and improving our water bodies as well. We use these products in several innovative projects, including a road project in North Delhi, and also in building the annex of the Supreme Court of India. So with time, these products have got accepted and have gained greater acceptability. There's also been a regulatory push from the government as well to try and ensure that these products, at least 5 to 10%, are made, compulsorily, mandatorily usable in projects. Next, please. This, as I mentioned, was India's first C&D waste recycling plant that we set up. And we have, based on this particular plant, the C&D waste management rules came up in the country. So again, it brings me back to the point that regulation supplemented by managerial innovation, I think really helps in terms of ensuring that, you actually make a tangible difference on the ground. Next, please. In terms of, next, please. Next, please. In terms of biodegradable waste, we converted the waste into compost. Again, a huge impact in a multidisciplinary manner, because we as a country subsidize our chemical fertilizer industry to a large extent. So what happens is something which is called the NPK ratio in fertilizers, which is the nitrogen to potassium to phosphorus ratio, gets completely skewed because of the overemphasis on fertilizers that are subsidized. And as a consequence of which, there's a huge impact in terms of the productivity of the soil, and also these fertilizers getting washed into our river bodies as well. So here again, organic compost can play a very big role in improving the productivity of the soil and reducing the impact of chemical fertilizers. Again, this is a matter where I think stakeholders like the chemical fertilizer companies, who have an excellent network of outlets, have to find ways and means of making organic compost available to the farmers, and the government will have to ensure also that if chemical fertilizers are subsidized, then organic fertilizer also should get subsidy in order to ensure that the farmer uses a combination of both in what we call integrated plant nutrient management. Next, please. One thing I forgot to mention in the previous slide was we also mainstreamed carbon revenues in our composting efforts. And over 2.2 million tons of greenhouse gases were mitigated, because as you know, if waste is dumped, it generates methane, and methane is 21 times as globally warming as a ton of CO2. So all these projects have a very, very strong impact in terms of climate change mitigation as well. Next, please. These are some of the farmers who have benefited from the organic compost produced at our facilities. It's not an, how should I put it? The difficulty with these projects is also because the waste that we get to our facilities generally tends to be not segregated. So segregation again has to be slowly and steadily brought into play. It's happening, but it's happening very slowly, and there needs to be a consistent effort to ensure that segregation is mainstreamed as well. Next, please. The combustible waste itself. Next, please. The combustible waste itself we handled in a place called Gazipur in Delhi, which is another huge dump site, which is as tall as the Taj Mahal. It's close to about 65 meters. And so here again, we set up a waste to energy plant that was Euronorm compliant. Next, please. The plant has handled over about 1.5 million tons of waste, and it has produced 150 million units of green power. The plant again will mitigate about 3.3 million tons of greenhouse gas emissions over time. And the government was, we spent a lot of effort in getting a feed-in tariff of about 10 cents per kilowatt hour for our tariff. Next. In this project, we also integrated the informal sector. Again, it's extremely important to ensure that we mainstream the informal sector in our efforts, because centralized facilities on their own, unless they're backed by the informal sector as well, it would be very difficult to make these facilities successful. So we actually transformed the lives of about 300 waste picking families who worked on the dump site, and provided a different occupation for them, where they used recycled products, and we created a producers company for them, an all-woman cooperative, educating their children as well. And from waste pickers, they became artisans, and it really improved the quality of their life and also the lives of their children as well. These are some of the products that were made by them. In terms of recycled products itself, it's just incredible the kind and quality of products which were made from recycled products. They use something called wounded flowers from the flower market waste in order to make these products as well. So again, it's something where each of our cities has about 150 to 200,000 rack pickers. So if they can be mainstreamed in the efforts, it would make such a difference. And no matter what one says, they play a very big role in helping in the waste management effort. And actually in India, a lot of segregation happens because of the rack pickers. They take away all the valuable plastic. For instance, all the PET bottles are removed by them, which are recycled in turn. It's only the single-use plastic and the very thin plastic, which is less than 50 microns, which they can't use, which is left behind. Next, please.
Mahesh, I just want to be mindful of our time here and our other speakers.
Yeah, sure. The other thing that we did was, in terms of, we capped a dump site. You can see on the left-hand side, this was the state of the situation in terms of a dump site, which we reformed the slopes and later, transformed it to what you see on the right-hand side. We sunk about 36 gas wells. And the only mistake I think I made was I did not buy that building, which is right next to the dump site, because people who lived in that building, actually, their property prices went up. And for the first time in 20 years, they opened their windows. Made a very big difference to their lives as well. Next, please. E-waste is going to be the next big challenge, which all of you are aware of, and we have not even begun to get ready for it. This is another big problem that we are going to have unless we do something, in a concerted manner on that. Next. Processing plastic, another marine plastic, is a huge problem in the country, and much of the marine litter comes from river bodies located in South Asia, and this is another problem that needs to be tackled. Next, please. In order to bring all our learnings together and try and find a solution to this, we came up. I'm coming up with the concept of a material waste exchange, which will bring both the waste generators and the processors onto one common platform. Next. You can see here the waste generators, there are waste pickers, there's a market, and then we have the waste processors on the other side. If one can bring both these two universes together, it will greatly help in reducing plastic waste, for instance. For instance, India has about 200 cement plants. So each of these cement plants, if they can take some of the single-use, non-recyclable plastic and use it as fuel, not only it will help them reduce their fossil fuels consumption, but it will also help in ensuring that the plastic waste is the single-use plastic, which cannot be used and which generally finds its way into river bodies and the seas, is reduced. Next. This, as I mentioned, is the exchange. I'm planning to bring all the generators, the informal sector, and the buying and selling platforms, and the regulator, which is the Central Pollution Control Board, onto a common platform. Next. The guiding principles of the waste exchange will be traceability, transparency, integrity, and consistency. Next. So my point, to sum it all up in some sense, is unless we get all the stakeholders together, which is the government, the informal sector, the formal sector, industry, each one of us can play a role in terms of ensuring that we segregate our household waste. Unless we approach this problem at a unified level involving all stakeholders, this is going to be a problem that is only going to increase with urbanization. So that, I think, is the final message that I wanted to leave behind. And also,
thank you, Mahesh.
Huge impact. Thank you very much.
Yeah. Wonderful insights and programs and suggestions and solutions. We've had a number of questions, and want to acknowledge Manoj. You've asked a number of questions and made comments, and hopefully we'll be able to get to them after we hear from the other speakers. So I'd like to turn it over to Dr. Deshpande.
Well, thank you. Thank you, Stuart. Let me share my screen here. And so, Mahesh talked about large programs with a lot of impact. I'm going to talk about a little bit more of simpler solutions that come a little bit more bottoms up. So we have a work, we know that an ideal village needs a lot of interventions. But our work is primarily focused on income-producing activities, whether it's micro-entrepreneurship, skilling and education, or agriculture. So, and then to experiment with all these ideas is like a living lab. We have a 300,000 square foot campus, a lot of 3 large very campuses, 700 people on the payroll, and so on. So what has this got to do with water? So water turns out to be the biggest multiplier of income for farmers. These are all arid lands where they don't really have irrigation, but it's not like it doesn't rain. It rains anywhere from 50 to 80 centimeters of rain every year, which is quite a bit of water, but they don't have water when they need it. And the water just flows away, and they keep digging these bore wells, which get deeper and deeper and deeper. And so there's a huge shortage of water. So the idea that we wanted to experiment with, and the actual experiment started in 2013, was to see if we could build these farm ponds, which are owned by individual farmers. So if a farmer has 5 acres of land, you dig a hole that's 100 feet by 100 feet by 12 feet, which is enough water to irrigate 5 acres of land. So, and also we're trying to, I come a little bit more from the entrepreneurship and product development background. So we wanted to see if we could bring the same discipline to the nonprofit sector. So 2013 to 2015, we built about 150 farm ponds. We built it free for farmers. We didn't charge them anything. We learned how to build the farm pond, which we can do one in about 4 days. And in fact, we proved that all the 150 farm ponds did double and triple the income of the farmers. Typically, the income is about $1,000, so they can make maybe another $1,000 to $2,000 more every year. And so once we had that proof over the last 6 years, we did about 6,000 of these, out of which, a typical farm pond costs about $1,000. So the farmers actually paid $800 and we paid $200. We meaning our foundation and other supporters, donors, and so on. And all the 6,000 farm ponds are working. People are very happy. We got a big backlog of these farmers who want more farm ponds, about 10,000 of them. So we just launched the third phase of this program, where we're doing 100,000 of them. So that's a $100 million project. And the financial model for this is that the farmer actually contributes $200, and the other $800 actually comes from State Bank of India, one of the banks, which will give a loan to the farmer. And then we work very closely with the farmers, with lots of hundreds of people that we have, and make sure that the farmer actually makes more money and returns the money. So this program just started off last year, and so far it's looking very good. So we used to do about 1,500 a year. So this next year we're going to do 5,000, and hopefully then 10,000 and 20,000, because India needs millions of these things. But to be able to scale these programs, you do need technology. You can't start with technology. If you start with technology, you won't get anywhere. But once you have a solution that looks promising, we use a lot of technology. In fact, our global chief technology officer is right there in Cupertino next to Stanford. And what we do is we have a rural technology transformation center. There's about 30 satellites that hover around India collecting lots of information. So he's capable of collecting petabytes of data and either look at macro or micro views of water for each of these lands. So if somebody has 5 acres of land, we can actually take a look at it, recreate the history of that land from water perspective for the last 10 years, and ideally locate these farm ponds. And so, so this really allows you to do assessment in a global way. It allows you to plan. It allows you to, because even 5,000 farm ponds will require about 500 of these machines at the peak time running around, which means there's a lot of logistics and a lot of management coming together. So to really implement all this, we are implementing this Rural Technology Transformation Center, which really helps it. So I'm trying to rush through so that we have a little bit more time for questions and answers. So maybe let me just summarize what has been the learning. Number one, when you work with people who are resource constrained, who don't really have disposable income, you have to co-create the solution with them. When you create a solution for people with a lot of disposable income, your solutions don't have to be perfect, because it's very forgiving. Because if all of us who have disposable income, if we try something and if it doesn't work, it doesn't really kill us. Whereas people who are resource constrained, if you ask them to risk anything at all, it's very tricky for them, because even risking $1,000, $800, $500, that's a huge risk for them. So the solutions have to be recreated. They have to be perfected to the point where you almost guarantee that they will produce the impact, which is sort of the missing piece in the nonprofit world. Because most of the nonprofits don't charge the beneficiary. So there's not that constant feedback loop to tell you whether the solution that you have actually works or not. So one of the key themes of a lot of our interventions is cost sharing, is to make sure that the people that we're trying to help also are a part of the equation. And so the fact that this solution, it guarantees both increased income and helps the water levels, is what makes this solution sustainable. And so how do we know that it's working so far? I think I would feel a lot more comfortable once we do 20, 30,000 to say that this whole thing really works. But right now, I think we have a big backlog of farmers who want these farm ponds. They're all willing to pay. And so that says that it's sort of working. And once you have a solution like this, then we need all the tools that we use in the developed economy. We need technology, we need financial engineering, we need good supply chain, we need logistics and so on. And so the approach that we're taking is to really create bottom-up solutions. And if you really find solutions that work, then you start bringing in more sophisticated tools to actually solve the problem. So I'm not an expert in water. As you can see, it's a very entrepreneurial approach. Entrepreneurs usually start solving a problem without knowing too much about anything. They just fall in love with something and say, I want to do something. And somehow they stumble into a solution and then they start scaling it. And I'm very much looking forward to the next talk, Rachel, who is a super expert in water and can really tell us how to look at water in a systemic way and solve very big problems. Rachel, all yours.
Well, Desh, thank you so much. But before we move on to Rachel, there's a question about how do you deal with the ponds and the treatment of water, and what are you, what technologies you're using for that to make that water clean, potable water?
Well, it's just rainwater, and that water is used only for agriculture. And so you don't have any of those issues. Also, we only work in places where the water doesn't seep away. So we don't have to do linings at the bottom or anything like that.
Great, thank you. Wonderful work that you're doing. Thank you so much for your leadership. Rachel, ready for you.
I am here. Hi, hang on, let me just make sure that I am, all right. Okay, I wanna make sure that you can see only my slides and not my notes. Can I get a thumbs up, Stuart? Just to make sure. All right, great. Yeah. So thank you so much. This is so fantastic to be on a panel, really, and to meet you. I wish we were in person and could grab coffee afterwards, but we'll do it virtually. I want to use the time, and I'm going to try and be as efficient as possible with my time to provide a very fast and high-level run-through just to sort of set the scene of pre-pandemic life, and then in the throes of it, pandemic life, from the perspective of someone, that's me, who has worked, really at this policy and market frameworks sort of space in the water sector. So, the work that I have done in my career is about how do we create the frameworks that can support innovation, and whether that's a business model or a finance mechanism or R&D, et cetera. So I'm then going to share a little bit of information about this thing that I've called the STAR training program, which I launched with a team from Stanford during the pandemic. And then I want to just share a couple of questions about what I would like for you, just prompting questions for you to think about in this post-pandemic normal ideal village. So what were we doing before? And again, many of you might not sort of be working in this market space. So just want to tell, we were making some progress with emerging models for post-construction support of water services and sanitation services. So things like looking at the scale of hand pumps to be able to layer in insurance products, all right, and trying to create new markets and using the sort of suite of finance mechanisms to address sustainability of water and sanitation services. And there was maybe some conversation about connecting with climate change on the mitigation side. There was a lot of discussion about how do we mitigate on an adaptation side. And overall, people were coming around to this idea of systems change. And you might have heard in your domains lots of discussion about systems change. In my world, it often meant a conflation of like, this is the new buzzword that will replace governance, or before that, enabling environment. And the challenge, of course, and the danger of that is when you don't think of yourself as part of the system, you say, oh, governance needs to change, or the enabling environment needs to change, but not I and my own practices and my own organization needs to change and can change. So basically there was a lot of business as usual. And, increasingly there was trying to figure out how to spin the idea that the world is off track to achieving the Sustainable Development Goals. And then bam, the pandemic, right? And the system was faced with a real challenge and a stress test. And suddenly we wound up talking a lot more about WASH in healthcare facilities. And we kind of learned that actually the system is pretty resilient as it is, right? Development practitioners moved into reactive mode, thinking, okay, well, now I'll just move from a development mindset to a humanitarian response mindset. And again, those systems are pretty entrenched 50 to 70 years later after Bretton Woods, right? So a lot of stuff hasn't changed all that much with the pandemic, but some things have. Partially, at least for a little while, people stopped traveling, right? And that, like the idea of somebody who works internationally to not be jetting around the world was radically different, right? And it doesn't mean that everybody is still in that space, but a lot of us are, where we're not traveling. And that is a systems change. And what's interesting to me is the feedback mechanism was I suddenly had resources in my program that I couldn't spend, right? So again, I am a finance expert who very quickly moves into organizational issues and governance. We became more dependent on data, Wi-Fi, MiFi, phones, and we realized that we could invite people in to our conversations that we never could invite before, provided that they had Wi-Fi. And we have a lot of embedded assumptions about that. One of the things that I've learned over the course of this year is that it actually costs about as much to put on a virtual program, all told. The budget lines are different, but it actually costs about as much if you want true participation as traveling and doing it somewhere else. So there are like some efficiencies, but it's a different mental model for how we structure conversations. Again, a systems change may be kind of boring, but potentially revolutionary if we look back at it 10 years from now. So there are other ways the system's changed in terms of philanthropy and funding and American funders wanting to fund in America, all of these other, fissures in the system sort of surfacing. But I will say, I think my overall experience right now is that the systems that hold our social and environmental problems in place are shockingly resilient. They're surprisingly resilient. Systems change is hard. So in the midst of all of this, I was asked to design a training program to teach systems thinking approaches around problem solving with the Hilton Foundation's portfolio in West Africa and then in Uganda, with this idea to run a program. And what we had as an objective very much throughout that was really focusing on how do we train people who are based in the countries that we care about to then be able to work locally so that you don't have to hire me. You don't have to bring in Stanford. You actually have a market, a supply of strategy and development and systems thinking professionals working locally who can support, high-level proposals and programs. So we had bold ideas. I really think, when I designed the curriculum, it wasn't about solving a huge, big social problem. It really was about solving small, what I call like small P problems, meaning it's the stuff around when we get to the root cause of a problem, it might be something very simple. It might be, for example, the lack of a calendar, a shared calendar. It really can be organizational, minute things that can have big impact in terms of how we work. It could be that my timeline of receiving due diligence for an investment doesn't actually map the timing of when the data comes in. So then there's a quarter lag in terms of being able to inform decision-making. So we get down to those granular pieces. I had to pivot with the workshop, obviously, and I'm really pleased with the results because we now have a virtual program that is 100% online. It is fun, it is interactive, and we're delivering results. And I don't have photos, unfortunately, but I want to tell a little bit about how we did it just for a couple of minutes. So here what we did is I created this thing called Kila, and it's a fake district. And one of the things that is really interesting about it is it layers in, it's built on a game that I led at a conference that basically where you get a role, you get an avatar, You get an organization and a personal mission, and then you're confronted with some of these political, economic, financial challenges. And you then have to make decisions, and then there's feedback and a response. And what we did was we converted that to an online format where participants are able to engage with the tools that we use, which draw from lean thinking, business model canvas, relationship mapping, and kinship networks, and storytelling. So that's sort of the idea around how do we get people to think about continuous improvement in that way, and in an environment where everybody's starting from the same playing field. So, you play one of 6 roles, and you get letters from your boss on a regular basis. And there are things like Twitter hacks and, news drops where you can learn about the program. And through this is how, you're learning to ask good questions, to visualize, to communicate complex issues, and really get comfortable sitting in a problem space before we jump to these conclusions. Like Desh, you were saying how people come with solutions and they want to scale solutions, but maybe they don't actually know what the problem is. And I think this is one of these dysfunctional things in the aid context, is that money does not come from the local environment. It comes from outside. So if I can convince Stuart to fund me, it doesn't matter if the problem actually exists or if that we're actually addressing the problem. So there's these disconnects that we have to sort of start unpacking. So I'm just going to move through. And these are some of the mindset things that we're working to really shift, right? So when we're working with clients and we have our trainees working with clients, if you name a problem, you say, I want to solve the problem of 97% of clinics in Ethiopia don't have access to safe water, which is a crazy statistic, right? And that's a crazy statistic. Okay, well, if you're going to start to solve the problem, you should start by understanding your own relationship to it. So when we worked with nonprofits in Ethiopia, one of the things that water sector professionals said, which is, one of these things where you say, okay, they're engineers and this is their domain is water. They said, well, maybe it's because the medical facilities, the directors of those medical facilities don't know the importance of safe water in a healthcare context. And we were able to say, really? Well, why do you think that? Is that, and unpack it. And what we got to was something totally different, right? But it's this idea of we work in silos. We don't always think about the interconnectivity of the problem or even our relationship to it. So that mindset, let's just say, of an engineer who thinks that medical professionals don't understand the value of safe water, that's something we can work on, right? Of really trying to unpack it. Why do you have that belief? What evidence do you have? What assumptions are you making? How does that serve you? How does that mindset serve you? And so then as coaches, what we're working to do is empower our clients who are local government officials and people working in Ghana, Uganda, and Ethiopia to solve their own problems, which is also a very disruptive thing in the system. Oftentimes people will hire my colleagues to solve their problem for them, or to take their information, and because I am a consultant, my brand gives them the thing to take their idea and it gives a stamp of approval. What we're trying to do with the STAR program is empower people to solve problems on their own in their own space without us. And we'll see if it works. It's a risk. And part of that is by starting small, right? So not taking on the really super big issues, but again, starting with these small key problems. And so our progress to date, our progress to date is we've been pretty successful. We're about done with our training program. We're very excited. I don't know why my slide is, there we go. We've trained 20 professionals working in Ghana, Uganda, and Ethiopia. And I think that one of the most interesting parts about this is this mindset shift that our trainees are coming back. They're very excited. They're already reporting that they're using the methods that we've taught them in their work and in their personal lives as well. One person is using lean thinking to design her wedding, which is super exciting. And we've been able to build a community online, which is also very exciting. So I want to just think about and prompt some questions. And Stuart, if you'll just allow me
Yes, you're good.
As I think my call to action, right? So my call to action is this. I know I've rambled like through this whole program trying to go as fast as I can. I'm more than willing and happy to talk about this program because I'm excited about it. But what I want you to do is maybe think about, as we're talking about the ideal village, right? And you think, and this is one of the things I love about Keela is an ideal village. It has all of the problems, but all of the community in a simulated environment. But when we think about our organization in the spaces and the domains where we work, what are we doing that's no longer acceptable? Like in the world that we want to create, that is the ambition of the ideal conference, right? What organizational behaviors would not be allowed if we're achieving that vision, right? And what behaviors am I practicing that really would be very foreign if the world that we lived in embodied the values of the ideal village, right? And then from there, look and see, okay, well, what changes might I need to do to get to that goal, right? And maybe it's decarbonizing your water work. Maybe it's eliminating international travel for the sake of field visits that don't really have a purpose. Maybe it's allocating funding in your programming to the hardest to reach communities first. So start with the last mile, even though it's harder and more expensive, rather than cherry picking so that you can say to funders that your model works and is scalable, even if it's not really, right? Maybe it's thinking about your scale before you implement to actually understand, if I'm successful in the work that I do I need to scale my organization, or can I give it away? Can I give away the IP so others can do it, right? Like, do I have some other incentive? Money, sure, and financial incentive, but maybe there's something else we could do to like be able to distribute those innovative ideas more widely. So there are a lot of different things that we can do. And I'm just, I want to invite you, whether it's at lunchtime or now or whenever, to actually think about these questions and write down, like take a piece of paper and a pen and write down, like, what is an organizational behavior you practice that is not congruent with the aspirations of the ideal village, right? Or what are you doing? And just write it down and name it. And this is one of the things that we talk a lot about in our work is sometimes just naming something and being aware of it, that's enough, right? Acknowledge it, and then it'll come back to you and you'll start seeing those changes as you go. But being aware of the practices that we live as individuals and organizations and seeing where it is congruent or incongruent with the values we want for this ideal village or world is actually a really great first step to making that change. And I will hand it back over to you, Stuart.
You are so inspirational and so enthusiastic and positive, Rachel. I love how you've gamified these challenges to come up with solutions. I'd like to bring it to Desh and Mahesh to talk about your questions and your answers and how the three of you can look at working together in these solutions. You each have said this is a local issue that has to be taken ownership and stewardship locally. And I'm wondering, how you all can look at working together.
Well, if you want me to go first, I think I started off more as a high-tech entrepreneur, MIT, Stanford, all this stuff. And so I think like Rachel was saying, the mistake that a lot of us, we all have a deep passion to help these villages, but we always start with what can I do that I'm good at? Whereas the starting point has to be, what is it that they need, right? So it's co-creating and everything else. But as things start scaling, I think you do need policies, you need financial engineering. For example, India doesn't need 100,000 ponds. It needs, I don't know, maybe 10 million ponds. So how do you go from there to the next phase? I think you need a lot of systems thinking and scaling and everything else. And that's where we can sort of use a lot of the methodology that we use in scaling companies or any solution. But the fact that it's very grounded in what with similar to what Rachel is saying is, I think, is the most important piece.
Thanks, Desh. Mahesh, comments from you?
Yeah, sure. I think I agree with what Dr. Deshpande just said. I mean, in terms of there's a huge requirement to involve communities There is a huge requirement to share best practices, to find solutions. And as I said, even during my talk, it's every stakeholder has to come together to make this happen. This is not going to be something that only organized industry or let us say the waste management companies alone will be able to do. And it's such a multidisciplinary aspects to it. You have climate change getting mitigated, you have water bodies being held, you have employment, it virtually touches every single sustainability development goal that one can think of. So in some sense, it's so obvious that it needs to be done, but yet, Stuart, it never happens. Unfortunately, on the ground, it takes a lot of effort in these sectors, especially water, sewage, sanitation. I think this is where the rubber hits the ground, as they say, in every sense of the word. So unless this happens, it does not matter how high tech we are, because it doesn't translate to what is really required on the ground. So from my point of view, at least my learning and my business has always been that you have to just constantly be positive. You have to keep trying. You should have Rachel's optimism and, keep at it constantly. And then finally things happen on the ground. And I think once those things happen, they're basically irreversible. The good continues. And I think we should just take whoever has whatever to offer in some sense, without getting into this us versus them, big versus small, industry versus informal sector, and just get everybody's, how should I put it, motivation working towards a positive direction. And then only it'll happen, especially in countries like ours, where for every there's so many naysayers that you really struggle at times to make it happen.
Can I just have 2 seconds, 30 seconds? Yeah, actually, I know you want to turn it over and we're really late.
Yeah, and there's actually a question about how how people can join the STAR program. So if you can let everyone know how to do that,
I created Yes. So I created a form late last night. It's a very low budget Google form, but just for this conference, in case people were interested to learn more, please, complete. But I think one of the things that I just want to acknowledge very, very briefly is I think the water sector for 20 years has focused, since the Dublin Principles, on this idea of partnership and collaboration as a way to make change. And I would maybe like to be provocative and say that partnership with this big, lofty goals, you basically spend all of your time trying to arrange this very high, lofty vision without looking at what do I need from the Deshpande Foundation in order to scale, or what does the Deshpande Foundation need to scale, to do this, and talking with the financier to actually get it done. This idea about collective action at a global level is not fast enough to meet the needs that we have as a climate, and bringing everybody along and having everything be consensus based for water is, I just think, it's not the way to go when we have technologies for communication and transparency, but also a real need for action. So I'm just gonna I'll shut up now though, but I'm really excited to continue.
That's a perfect note for us to end on. It's about collaboration and it's unity. Water unites us all, and we need to all come together so we can work on our projects together to create the solutions, which are all possible. And it's all about people and it's about money. And both of those resources and assets are there, as we know, through this brilliant community. And we're going to do it together. We are doing it, and we will achieve these results and these goals. I just want to make sure everyone can see in the chat that Rachel put up a link if you want to know more about her program and join that program. I want to thank Rachel, Desh, and Mahesh for your brilliant work and your commitment and your passion and your actions and results. And we'll turn it over to you, Dr. Anand.
Thank you, Stuart. Thank you. Many thanks to all the speakers for an absolutely inspiring and very informative session. We will move on to the next session, which is our closing keynote for this day. And I'm very pleased and privileged to welcome Balaji Ganpati. Balaji is the global health head of CSR and the chief social responsibility officer for Tata Consultancy Services. He serves as the chair of STEM Connectors, STEM Innovation Task Force, and vice chair for the Million Women Mentors Council. He's also on the executive committee of Impact 2030 from the World Economic Forum's steering committee. So over to you, Balaji.
Thank you, Dr. Anand. It's such a pleasure to be here and be part of today's proceedings. I think I come in with a lot of optimism that people can definitely lead change in society, and having a forum like this where everybody comes together to contribute and really look at collective action moves the needle significantly. Today, what I want to do is to share with you a few thoughts in terms of what companies can do to create impact at a local level, and especially with the focus on purpose and technology, how that can really make a huge difference to society. In keeping with the the conference theme, I'm focusing on India and sharing a few examples of what kind of impact can be created through cross-sector collaboration and public-private partnerships. And I hope this will serve as an inspiration for those who are looking to create both impact in terms of scale as well as in terms of depth of outcomes. So that's what I wanted to leave with you today. So for those who are not familiar with TCS, Tata Consultancy Services, we are an information technology major, 500,000 employees from more than 150 nationalities. We have revenues of about 22 billion and market cap of over 200 billion. So second most valuable technology company in the information technology space today. Our purpose is to create better futures through collective knowledge and the power of innovation. That's what we are doing for our customers. And today what I want to share is that the similar approach for the community and what can be done to really create a societal impact is what today's purpose-led organizations are all about. And all of this stems from 153 years ago when the Tata Group, which TCS is a part of, our founder put a vision together that in today's world is known as stakeholder capitalism. But basically he said that in a free enterprise, the very purpose of existence of the business is to serve society. And even today, 66% of shareholding of the group companies is with two philanthropic trusts. And through this model, the profit and the dividends that are created by the companies is going back into the community to address the most important issues that the country faces in India and also in places around the world. So with that context, what I want to share with you is that it is my belief that everybody is born with equal potential, but not with equal opportunity. So what can we do about that? And at TCS, it is our mission to connect people to opportunities in the digital economy. This is what we do for our Fortune 100, Fortune 500 customers and for our employees, as I shared, more than 500,000 technology professionals. So how do we harness the same kind of capabilities to do this for the community? That's our mission. And in doing so, we recognize that there are those who need more attention and support because they are more marginalized, especially women, youth, and whether it is socially, economically, or otherwise excluded groups need to be prioritized in this journey. So how do we intentionally create equitable and inclusive pathways is what we approach in this space. I also want to be mindful of the fact that this is been a very difficult 18 months for the world at large, and it continues to be. But a lot of advances have been made thanks to the vaccines and thanks to the efforts of many countries, government, and companies. And here is a quick glimpse of what we have been doing in the last 18 months. Starting with a $200 million commitment to support India and the government in their efforts. And we've set up COVID centers, we've set up hospitals, we've distributed equipment, and then from health turning into food security, supporting those who are in food deserts and identifying that, looking at education and the disruption that has been caused by the lack of access and addressing that for institutions, for people who are in remote parts of India and around the world, and also coordinating and participating in innovation to create tests, vaccines, and other genomic efforts. So these are some efforts that we have taken during these 18 months, and just a reflection of the need that exists and what we need to continue to prioritize as society. So before I go into the few examples that I have to share, I think, I heard some of the previous speakers talk about systems thinking and the need to look at holistic models. So I want to offer a model that we are utilizing to do our work in the community. And our engagement model is built upon the 4 C's, as I call it. It's 4 forms of capital: intellectual capital, technology capital, human capital, and financial capital that, when put together, can create a huge impact to any issue that you pick up in society. Of course, using a theory of change to understand where people and communities are at, and starting from that point of view, and then navigating from that to what are the kind of outcomes that they decide to have, that, and building programs and building partnerships to address that, right? It is my belief that, when you look at an ideal village, a similar holistic approach where different players, different partners can come together to address one or more of these areas is a model definitely that can create a lot of impact. So let's, and in using this model, how we are approaching it is to build a purpose ecosystem. And think of it as, people and communities are at the center of that ecosystem. How do you really advance them as an organization, what you're looking at is programs that are bespoke, that are addressing basic needs that the nation has, whether it is in terms of education, skilling, entrepreneurship, employment, or health and wellness, water and sanitation and hygiene. All of these are topics that are being discussed today and tomorrow in your conference. And, it gives us great joy to see that, at the same time learn from that, so that we have a better understanding of the issues and what kind of solutions can be created. And, and this is how we are building upon our purpose ecosystem as well. We have programs, we have projects, we have partnerships, and then, at a community level, at a country level, and at a company level, we try and replicate and scale this effort. So with that, I told you I'll share with you 3 stories. Let me start with the first one of an average, middle-aged, woman in India called Nurabati Patel. And, a couple of years ago, when she first interacted with us, she was the story of any such person in India, right? The breadwinner of the family is her husband. She has 3 girls who are her children, and she was struggling. The family was struggling to make ends meet. He was a daily laborer, in fact. And Nurabati was not literate. She did not know how to manage her finances. She did not know how to, read and write. And this was the condition that she was in. In participating in the adult literacy program that TCS has, we were able to engage with her and provide her functional literacy, the fundamentals of reading, writing, and arithmetic, and at the same time, some element of financial literacy, so that once she has some basic understanding of reading and writing, how she can do math, how she can improve her numeracy and start to manage that. And as a result of that, her self-confidence grew, and she was able to start thinking about supporting her husband by creating additional income. And her entrepreneurship spirit came alive, and she started to become a vegetable seller. And she started earning about 300 rupees a day, which for a family of her social strata was a very important daily income to have. This is a story of millions of people across India who, if given the opportunity to really stand up on their own 2 feet, given the dignity and the self-respect and the skills to advance their own future, they can go places. And that's what our adult literacy program is focusing on. And it has technology built into it where, the whole cognitive theories and game-based approach and role plays are incorporated into it. At the same time, it is available in any time, anywhere kind of access through mobile or through computers and other technology. It provides this literacy in 50 to 55 hours time. And that is how we've been able to reach about 1 million people in India across India in 9 local languages. I just wanted to share with you a glimpse of this story. So the path to livelihood is through, functional literacy, financial literacy, digital literacy, leading to livelihood. Another story I want to share with you is that of Ujjwal Mondal. I met him just before the pandemic started in West Bengal. He lives in a district called 24th North Paragnas, which is bordering Bangladesh. And his is a story of young Indians who, he's a graduate and from a remote part of the state. So he has a lot of aspiration, but at the same time, he did not know which path to take. He did not see himself in the private sector for long. He had a lot of entrepreneurial spirit. And he became part of TCS's Bridge IT program. This is a program that we are running focused on marginalized youth in rural India, especially in aspirational districts, as identified by Niti Aayog, right? And through a 5-year program, we are working with the youth to give them, basic skills, business skills, entrepreneurial skills, help them set up a business, and use digital means to really create revenue lines based on what is the need in the community. It could be things like government services, citizen entitlements, rather, financial services. It could be healthcare, telelaw, many of the areas where government has amazing schemes in place. And through digital means, having somebody help address the gap could bridge that solution. The interesting thing is that against average earnings of about 4,000 to 5,000 per month that somebody who's employed in a rural setting would make, entrepreneurs who are part of this cohort are earning about 18,000 rupees per month. And in many cases, they are earning much more. Ujjwal's case, he's earning about 100,000 rupees per month, and he is employing 5 more people in his village to support him in the services. With that, I wanted to share this story and then demonstrate what collective action can do to make it impact.
साथ में भी कई मुश्किलें आती थी, टीचर्स नहीं पढ़ाने देते थे, क्योंकि हम एक दलित की बेटी हैं। गांव में कई तरीक़ा की समस्या रहती है स्कूलों में, कि खाना पीना सही से नहीं देते, उनसे छुआछूत रखते हैं। छोटे कास्ट के बच्चे होते हैं उन्हें अलग बैठाते थे, और जो बड़ी शेड्यूल के बच्चे होते हैं उन्हें अलग बैठाते थे, और उनको पढ़ाते थे ज़्यादा, और जो गरीब बच्चे होते हैं उनको नहीं पढ़ाते थे। कई बार टीचरों ने मना किया, नहीं हम नहीं पढ़ाने देंगे, क्योंकि जब हम कंप्यूटर खोलते हैं वहाँ पे तो सारे बच्चे इकट्ठे होकर आ जाते हैं, क्योंकि उन्हें कंप्यूटर अच्छा लगता है। तो जब हम अपने बच्चों को पढ़ाते थे तो जो बड़े कास्ट के बच्चे हैं तो उनको भी लगता था कि हम भी पढ़ें, तो उनको थोड़ा ऐसा लगता है कि इनके मतलब ऐसा ना हो कि ये बच्चे सीख जाएं और हमारे बच्चे नहीं सीखें। तो फिर वो भी बोलने लगे, अच्छा नंदिनी तुम सभी बच्चों को एक साथ पढ़ाओ।
सोचा कुछ करना है अब, तो करने के लिए सबसे पहले हमने देखा कि कुछ अपने गांव के लिए ही किया जाए या सोशल वर्किंग के लिए किया जाए तो अच्छा रहेगा। कॉमन सर्विस सेंटर यानी कि जनसेवा केंद्र के माध्यम से तहसील स्तर की सारी सेवाओं को प्रदान किया जाता है और लोगों को मदद की है सेंटर खुलने के लिए। और लोगों को मैं बताया हमने कि आप लोग भी हमारी तरह कॉमन सर्विस सेंटर लेके अपने गांव वालों को ऑनलाइन के जितने भी काम हैं आप खुद करके उन्हें मदद कर सकते हैं। मेरी आशा है अधिक से अधिक लोगों को इससे जोड़ करके और इसके बारे में बता करके हर जगह इसका विस्तार किया जाए, जिससे कि नवयुवाओं में इस प्रकार की जागृति फैले और इसी उत्साह के साथ निरंतर आगे बढ़ते रहे।
हमारा जो सपना है हम कंप्यूटर टीचर बने। स्कूल पढ़ाने के बाद 1-2 घंटे औरतों को भी पढ़ाते थे, तो कुछ एडल्ट लोग पढ़ने के लिए तैयार होते थे, कुछ नहीं होते थे। महिलाओं को समझाना पड़ता था, बहुत कुछ कहती थी। अब गांव की महिलाएं तो बहुत कुछ बोलती हैं, क्या तुम हमें नौकरी दे रही हैं, इससे पढ़ के क्या होगा हमारे लिए। समझाया कि मतलब जैसे अभी तुम दादी हो, तुम्हारे छोटे छोटे बच्चे हैं तो उनको तो पढ़ा सकती हो, अगर तुम पढ़ी होंगी तभी तो पढ़ाओगी ना। बैंक जा रहे हैं तो किसी से क्यों ज़रूरत पड़ती है, जब हम खुद पढ़े लिखे होंगे तो हम खुद कर सकते हैं। हमें बिजनेस करना है, पहले दुकान खोलेंगे, सामान लेंगे, रखेंगे, मतलब अभी हम धीरे धीरे छोटा प्रिंटर खरीदेंगे और छोटे छोटे काम करेंगे। मतलब एक दुकान से हम धीरे धीरे बिजनेस बढ़ाएंगे, दूसरे गांव में भी दुकान खोल सकते हैं। अभी हम खुद करेंगे, फिर जब दूसरे गांव में हम दुकान रखेंगे तो उसके लिए लोग को कर देंगे। फैमिली से सपोर्ट नहीं मिलेगा, हम खुद करना चाहते हैं।
बाजार में रहे तो वहाँ सब पढ़ने वाला माहौल था, यहाँ देखा कोई पढ़ता ही नहीं, किसी के बच्चे पढ़ने जा ही नहीं रहे स्कूल में। वे बेटा पढ़ के होना क्या है, पढ़ने के लिए पैसे की ज़रूरत होती है। तुम भी तो बाहर पढ़ के आए, तुमने क्या कर लिया, जैसे तुम घूम रहे हो गाँव में ऐसे हमारे बच्चे हैं। कोचिंग सेंटर खोलना चाहते हैं, मतलब हम सिखाएंगे उन्हें हार्डवेयर फॉर्मेटिंग के बारे में, जैसे कि हम बच्चों को कंप्यूटर के बारे में सिखाएंगे कि डॉक्यूमेंट बनाना है, ऑनलाइन रिजर्वेशन करना है, फॉर्मेटिंग करना है। हमारे पास किसी का काम आया कि हमारा रिजर्वेशन होना, तो हम उस बच्चे से रिजर्वेशन कराएंगे। बच्चों की जो पढ़ाई की है, जैसे पढ़ाने के लिए वो बाज़ार भेजते हैं कंप्यूटर कोचिंग के लिए या अन्य सब्जेक्ट कोचिंग के लिए, वो कोचिंग सेंटर हम गाँव में ही खोलेंगे। तो गाँव में सब अवेलेबल होगा, तो जो गाँव के लोग हैं बाहर नहीं जाएंगे, ऑटोमेटिक उनका विकास होगा।
So the interesting thing is that young people who are in India, they have this unbridled enthusiasm to really be agents of change, right? And I think anything that we do as government, as companies, as non-profit sector, and others to really empower them, I think can go a long way in terms of creating generational improvement, right? And often an ideal village is one that really believes in itself, and that's what I wanted to share with you as the second story. I'll close with this third story, that an ideal village and this setting doesn't need to be only in India. And this example I want to share with you from a US context, where the disparities and the systemic inequities that exist between those who are getting jobs and opportunities that lead to better futures. I mean, all the social uprisings that we have seen over the past few years have a root in that, right? And it is a belief that, human intelligence is going to drive artificial intelligence. And therefore, how do we impart schools and educators and students with the resources and the skills to participate in the new opportunities that are being created? So we have two programs that are addressing this. One, which is creating digital innovation skills so that young people can identify problems that are around them in society and really use the power of design thinking, human-centered design, agile, and other technologies to create solutions that can lead to social change, right? Whether it is against the sustainable development goals in a broader context or community goals, which are aligned to that in a very specific context. And this program we've been able to run now in more than 100 cities in the US, and it is also running in about 35 countries globally today. And the second one is a teacher-facing one, because I also want to stress upon the fact that teachers are the unsung heroes of society today. Many a case, they are the ones who not only are helping to teach young people, but they are keeping them healthy, safe, taking care of the emotional needs. And it was important to work along with the education sector to create a program where it is transdisciplinary and curricular, and provide resources that can engage students in the 21st century skills. And that's what our Ignite My Future program is doing. And computational thinking is at the heart of that. So how computational thinking can engage and create those skill sets across all core subjects, whether it is math and science, which is the traditional STEM disciplines, but also arts and social studies and physical education and other areas. So I will end with a short video to show what the teachers and educators feel about that program. And if we have time, I'll be happy to take maybe 1 or 2 questions.
We're always looking for new and innovative ways to change our classrooms and adapt to the technology that we're seeing today.
It's important to share ideas, and just to have that free transfer of information is helpful.
Ignite My Future in School launched in September 2017 to really build the capacity of teachers. Teachers have been asked to deliver content in the classroom that they themselves didn't necessarily take in school. And so empowering teachers to develop their computational thinking knowledge will be critical to helping provide young people with the future skills they need for the workforce. At TCS, we've worked really hard to harness the abundance that we have and pass it along to teachers and educators everywhere. We've worked with more than 18,000 educators in 50 states, and that's really helped us surpass our goal of reaching more than 1 million students across North America. It's amazing to see how this movement has inspired teachers and students to adopt computational thinking as an everyday focus.
I would certainly say that activities that we're doing are real-world applicable.
Our students aren't learning the same way they were learning 10 years ago, and for us to be able to shift with them is really important.
I know that teachers are working so hard to be able to bring relevant content to their students.
Free knowledge, free information that we can use back in our own classrooms, especially for a district like mine that is a small, struggling rural school district. This is really important.
Ignite My Future!
So I hope those 3 stories gave you a good sense of what purpose-driven organizations can really do to drive impact in society, and also demonstrated the power of collective impact, especially engaging stakeholders who are close to where the issues are and involving them as part of the solution. I wish you and the Stanford team very best for the rest of the conference. And I'm very glad to see Ambassador Pradeep also here. Thank you for being here and your leadership and support in these efforts as well. Thank you, Sunny. And thank you, Dr. Anand.
Thank you very much for really inspiring, impactful, impressive, and informative keynote. That was wonderful. It is my distinct pleasure and privilege to welcome Ambassador Pradeep Kapoor, who is an international strategic advisor to Intellect Design Arena. And he's a former ambassador from India, who has been acknowledged as a distinguished luminary diplomat and an educator. More recently, he has co-authored an Amazon bestseller book called Beyond the COVID-19 Pandemic, Envisioning a Better World by Transforming the Future of Healthcare. So the rest of his extensive bio is on the website, and I welcome you, Ambassador Kapoor, to take this further. to give us the key takeaways and recommendations from today's conference. Thank you.
Thank you very much, Sunny, and thank you, Balaji. I had occasion to work very closely with TCS in Latin America and Chile also, and support their efforts in a very significant manner. But coming to the session today, oh my God, what a power-packed day from the word go. Brilliant presentations and discussions by the distinguished speakers. Congratulations to Stanford University and the Ideal Village Center in particular for putting together this conference. It is also, in my mind, in many ways, like a workshop. Thanks also to organizations such as the Wheels Global Foundation for collaborating and contributing to this effort, as also the Sai Foundation, the TCS, and many other organizations who have joined together. It is a very timely conference, Professor Anand. There have been very useful discussions, very actionable outcomes and takeaways. We are talking about Ideal Village Center. We are talking about rural empowerment. What does the word rural conjure up in my mind? As a person who's worked in international diplomacy for many decades, when I mapped the rural community in India, with which a lot of the speakers have been passionately and actively engaged, what do I see is a population of between 800 million to 900 million people. A population which is more than the entire populations of two big continents like North America and South America put together. A population more than the African population, more than the entire European population, more than the any other continent in the world, not just any country. Just China is just about much less in rural population than India is today. So to understand the scale of the problems, it has been very useful in the three sectors which we have discussed today, which are water, healthcare, waste management, and education, which are the first three verticals in Wheels definition of water, healthcare, education, energy, livelihood, sustainability. The Ideal Village Conference will be discussing about the other aspects tomorrow, beginning with a very important inputs by the great spiritual leader, Sri Ravi Shankar and others. But if I were to pause and reflect on the big picture which has emerged today, in a holistic way, what emerges is, first of all, my mind harks back to what Gandhiji said, which is, there is enough in this planet for everybody's needs, but not enough for everybody's greed. Now, bringing this from a macro to a micro level, it seems that the message which is being conveyed to all the participants today is that each one of us needs to get more engaged, more actively engaged in this effort for solving the problems of mankind, which are, also problems in the rural areas very significantly. And how do we do that? By contributing our time or treasure or talent, the 3 T's. If we can do all 3, it's the best. If we cannot do all 3, at least 1 or 2 of the 3 would be very useful. It also brings to my mind the Prithvi Sukta in Atharva Ved, which is the ode to the earth. How there can be sustainability if people respect the planet and the legacy of the environment. Coming now specifically to a holistic view of today's discussions, we will discuss all these sectors separately in the next few minutes. But what emerged on a global level between all these verticals that we discussed today was that to tackle these big problems of mankind, of rural communities whether it is in India or Asia or Africa or Latin America or USA or anywhere in the world, one aspect which is very, very important is that a PPP model is absolutely essential. What do I mean by the PPP model in rural empowerment? Public-private partnership, in the sense that the government is one agency which can bring scale and efficiency and effectiveness to the interventions. The NGOs, the INGOs are the other leg of this aspect, which can help in a very significant manner. And the private sector, public sector, corporate sector, let me put it that way, of the world, through their CSR, corporate social responsibility, which needs to be taken much more seriously, can help in a significant manner. In India, for example, this 2% rule, which was passed, that 2% of your profits have to be dedicated for CSR, is, in my mind, in my opinion, my view, a golden rule which needs to be replicated all over the world, which will give a push and impulse and fast forward the entire process. The communities need to be actively involved, of course. I would say that the Wheels model of Smart Village Development Initiative, which has at its core the smart aspects. Smart village is not smart city or smart as in smart, but smart where S stands for strengths of the community which is being impacted, the rural communities, for example, the strengths of the development accelerators, the government sector, the NGO sector, and the corporate sector, all the strengths combined together. So smart, that is the S. M is for measurable impact. We have to have measurements right from the beginning. A is for achievable, so that it is also accessible to the rural community. R is for replicable, so that you can scale it up. And T, we being from the IITs and from the Wheels background, T is for technology-enabled solutions. So once you bring in this construct, it becomes easier to do interventions which are useful and scalable. The other aspect which I want to talk about is that innovation and entrepreneurial approach to rural development is extremely essential. The more this is brought in, the more the communities themselves are activated to seek these solutions, it becomes more effective and more impactful. This is also at the global level, the country level, and the community level, that these steps have to be taken. Harnessing the power of technology to increase the impact we have seen in the discussions today is one of the essential. I don't need to delve on it right now, but we will talk a little bit more a little later down the line. And in a way that we bring it to the common man, how do we bridge the gap? We may be having a lot of solutions, but how do we bring it to the rural community and to the common man is also very, very important. I can create big solutions in the labs, but I have to bring it there to the ground level. And sustainability in every aspect of the interventions are required. Now, coming on to specifically healthcare aspects first, which we had a very good round of discussions. And we discussed about how the rural communities can be impacted and what are the shortcomings in terms of lack of healthcare personnel, which was pointed out very glaringly in one of the slides, which stuck in my mind as to the pro rata availability of doctors in rural areas in India. And the condition is similar or much worse in many other countries of Africa or Latin America. Can telemedicine operations bring in solutions in a better way, in the sense the human to machine connect, and how can that be bridged? That was another part of the discussion, with having people who are there on the ground to bridge this aspect. connected devices, technology, healthcare systems of the future need to be more digitized, demonetized, and democratized. How do we achieve that? Through artificial intelligence, through augmented reality, virtual reality, mixed reality, robotics, blockchain, machine learning, quantum computing, Internet of Things, Industry 5.0, data analytics. So those are areas which we need to discuss in greater detail. The data itself of the individual healthcare, etc., all the readings, tests, diagnostics, etc. How can the individual access that? The vaccine aspects, the supply chain, etc. The focused response mechanisms required in healthcare in terms of the fact that disaster management authorities, and if there is a repeat pandemic, it's not a question of if, it's a question of when, because once this has happened. So in the discussions of the, chef de cabinet of WHO, one thing which was glaringly missing was how do we trace out the origins of the pandemic and the virus so that such occurrences cannot happen again. This was unfortunately not touched upon if I had a chance to ask this question, because as Prime Minister of India, Modi, mentioned recently in a speech to the United Nations General Assembly, he raised a very big question mark on the work of WHO and the future of WHO. What is its contribution? Whether it is fulfilling its brief and the expectations and the aspirations of the global community, or does it need to be cast aside like the League of Nations was cast aside after the Second World War because it didn't live up to its mandate, and a new organization created which is not under political influence of one country or the other. So that is another aspect. Now, also, for example, if the biggest vaccine initiative in the world is the vaccine initiative by the Quad members, which is USA, Australia, Japan, and India, which is going to be manufacturing 1 billion more vaccines and distributing them all over the world, which requires it. That was also not really focused upon in that discussion, which would have been useful. But bringing all these aspects together, we had written this book, which Dr. Sunny Anand mentioned about. I'm going to request my colleague and my co-author, whom I value and respect very much, Dr. Joseph Chalil, who's a physician, to come in at this point and talk about also the other recommendations on healthcare, which were made in the book, which have been sort of come in for a lot of acknowledgement and acceptance, including in a big summit, healthcare summit last week in New York, where I had the occasion to interact with Dr. Deborah Burks and present it to her, because the outcomes she mentioned were very, very useful. But the ones which we mentioned were, I guess, far more revolutionary, let me put it that way. And Medscape Journal, which is the Medscape Journal of Medicine and accessed to by most of the healthcare professionals in the world, has done a very good article on the book also, besides all the other book launches and TV interviews and others. So Joseph, if you would like to bring in the Medscape aspects of the book and the outcomes and the learnings at this point, before I go on to the education and the water and waste management aspects. Thank you. Over to you, Joseph.
Thank you, Ambassador, and greetings to all. And thank you so much to the organizers, Stanford University and the Wheels Global Foundation, for making this happen. Again, I think it was a fabulous day with a great of eye-opening discussions and recommendations, especially in healthcare, to waste power management, to education. But again, coming back to the focus on healthcare, one of the things, again, the first book was focused on the health reform in India, again, post-COVID. Again, how do we make sure that the world is ready for the next pandemic or the next bioterrorism attack or a war? Because the preparations are very similar. We saw that America, with spending almost $4 trillion in healthcare, way more than the entire GDP of India on just healthcare alone, still wasn't able to provide a face mask to the doctors every day, or PPE kits, or unable to provide ICU beds. Even today, I'm in from Florida. and we are still full of hospitals, in the sense we don't have enough ICU beds available or ventilator beds available, even at the last stage. So even after spending all this money, it is not making it right. So I think the biggest problem we have, whether it's in India or in the US, is that we treat it, even though we call it healthcare, I'm not sure we truly care about everyone's health. This is more of a disease care system we were working on, or we were happy with for the past decades, whether it's in India or other places in the world, is that we didn't care whether the patient was working out or eating right or exercising every day or not drinking and smoking or anything else. It's just that when we get sick, we'll fix you up. And that's the whole thing was all about. So we need to change that. We also need to maybe combine and collaborate between our public health and the patient care. It all acted as two different systems worldwide. Again, things you could do, as Ambassador mentioned, from developing human resources in healthcare to simple things like supply chain, which is very critical in here, that we relied on one country for everything from our masks to cotton balls to injection syringes to needles. And now, whether it is the defense or it's in medicine, it's not acceptable that you have to have just one country providing everything. And then in the case of a war, a bioterrorism, or a pandemic, that we suddenly don't have enough supplies. And we had all this perfected just-in-time inventory and Six Sigma into management of hospital inventories, and everybody ran out. So this is not unacceptable. This is unacceptable. So we need to change that. Number two is that we need to make sure that we are ready for telemedicine, like Dr. Raj Shah was mentioning. Is America ready for it? Even the fragmentation of healthcare in the US is that if I'm practicing a physician in Florida, I'm unable to see a physician or a patient who's living in the nearby state in Georgia or in New Orleans, because I'm not licensed in that state. And if patient is dialing in from that region, it becomes illegal for a physician. So, having a nationwide license for American physicians or providers or nurses who could move from Michigan to New York to provide care was essential. Still not a fact here yet. So much red tape in all these things. Coming back to India, I think we are working on another book for the Indian health reform. Primary care is essential in India, and investment is critical. But I'm hoping we can go back in much details. Ambassador, back to you. You're on mute.
So thank you very much, Dr. Chalil. In the book, we had also talked about how, healthcare should not be tied to employment, as in the US, that the doctors themselves, the physicians, also need to become activists in the process in fighting for change and in fighting for getting proper response. We talked about how no government in the world is now capable of dealing with such situations on its own, even if it is the most powerful country in the world like USA, till it co-opts the civil society and the citizens into the actions required. Even with the most powerful weapons in the world, you have the president who's getting COVID. We have so many leaders all over the world who have got COVID. Some of them have passed away. So it is not at all possible now to let governments think in isolation, in silos, that they can manage it on their own. The leaders of these countries need to interact a lot more in a very sympathetic manner, in a very empathetic manner with the people of the country to be able to dialogue and understand. Then change involves collaboration, how we can bring free market principles to healthcare and make pricing also transparent. Or like in India, we can centralize electronic medical records, which have September 27, the Prime Minister of India announced this system, whereby it would be accessible to the patient. Patient will become CEO of his own health, and he'll have access to all the data and records and be able to take it anywhere, and the hospitals will be able to access it, so that there is no silos between one medical system and another, or a state and another, or a hospital and another. So many such solutions we had talked about, which I have to be looked at in terms of a medical national guard or a paramilitary medical force to be created to be able to react quickly, etc., etc. And we are now planning the next sequel of our book, which will also talk about the specifics vis-a-vis India. So that is about healthcare currently. I will now move on to the discussions we have had on the education sector, which have again been extremely interesting for a person like me who's been involved in this sector for a very long time. We have seen that with the pandemic, the post-pandemic normal itself has become very distorted. There have been some benefits of e-education and tele-education, but there have also been some drawbacks and shortcomings. Amongst the benefits we learned is that it gives scope for greater inclusivity, greater diversity, and addressing these concerns better for race and other aspects, ethnicities, in a slightly better way. Prevents sort of hazing or creating problems for your classmates, etc. But it still requires tremendous amount of inputs and efforts to become successful. What are the shortcomings? There have been phenomenal mental health issues which have been discussed by some of the speakers. These have increased very, very significantly. Social emotional support is required for the students. Role of technology is important to make it more easily, the transfer of knowledge happen more easily. Curriculums need change, need personalization, needs new paradigms. Then there are aspects of Wi-Fi connectivity, access to internet, equity, poverty, not only in rural populations in India, but in rural populations in USA, in the developed countries, in Europe, in all continents, all countries, I would say. Physical space is another big problem. We realize that, many people living in the same room, and how do you then give them access to e-education if there's so much disruption and disturbance? How do I concentrate? How do I focus? I have faced this problem with my students continuously. How do you build relationship with students? How does an educator build relationships? How do the students build relationship with each other? That is extremely difficult because still you have peer-to-peer interaction physically, in person. Online, I'm hardly there. I'm hardly committed. I may be switching off my video. I'm not interacting one-on-one. I'm not making fun. I'm not creating pranks in the class. I'm not doing mischief. How does that help me create bonds, which we created in our schools, primary schools, middle schools, high school, college, IITs, which last till today? So till that person-to-person interaction is there, that sort of learning curve is also very, very low. What about how do we involve the family and the community in a bigger way? How do we put the student at the center of all our thinking and new paradigms? What sort of ecosystem of education needs to be evolved holistically? And how do we have an asset-based approach to education in the rural atmosphere, in the rural ambience? Employability skills, how do we enhance those in terms of, how do we cope with the problem of this online education to increase employability? How does the industry help with certifications, etc., online training? Educators, we have seen in so many presentations, need specific training and skill development themselves to use technology in a more effective manner. There are many courses. They need to also learn how to use technology better. Design thinking would be very, very useful to generate grassroots solutions to local challenges. And in my opinion, X-Prize type of challenges by organizations like TCS, Balaji, if you're listening, to create those sort of X-Prize sort of challenges globally and in India for the rural community, for education, would foster learning in the education sector in a significant manner in terms of drawing up new paradigms. So, moonshot type challenges. For water and waste management, we have seen aspects about how recycling is very, very important, how technology can be a very phenomenal enabler, how pollution itself is, a very important issue and concern, whether it's construction and demolition waste or any other particle pollution. And repeatedly, we found PPP model coming up with the government, with the NGOs, with the corporate sector, and with the community. In all these aspects, whether it was healthcare or education or water or waste management. Income producing activity is another important aspect that for-profit philanthropy, as we say, as Dr. Raj Shah enunciated in the Wheels Healthcare Telemedicine Operation model, which makes it sustainable, and where the recipient at the village level also puts in some minimal amount of rupees. As I found in my experience globally in so many countries, bringing in big projects, big interventions on a very large scale, I saw many projects by many countries fail and fall to the, literally to the dustbins because of lack of local involvement in monetary terms also. So I made it a sort of a requisite in whatever I did in any country, developing country in the world or any group of countries, that those countries would also contribute some small amount, small percentage of money, and that would make it more sustainable. So similarly in philanthropy, it would work wonders. So income producing activities are useful. Concrete solutions are worthwhile, and you can start searching for those concrete solutions with addressing the small problems in a pilot sort of manner. Now, the closing keynote was also very, very useful. I compliment Balaji for the work that TCS is doing. I have known about some of it earlier, but it was again an eye-opener for me to learn about the other aspects of the work which your organization is doing in terms of skill development and digital skill development, for example, and change for empowering people and communities, and also building self-reliance through purpose and technology. So this sort of intellectual, human, technical, technological, and technical and financial capital is required in a big way. And that is what I would now, hand it back to Sundar and to Professor Anand to take it on from here in terms of how do we move on to the next day and to concrete sort of outcomes in terms of post-conference. What are the steps we are taking? 1, 2, 3, 4. Thank you. Over to you, Professor Anand and Sundar.
Yeah, thank you, Ambassador Pradeep. That was a very good summary of the day, and you touched on many points. Hopefully, we've recorded this, of course, so we'll hopefully be able to transcribe it. And we appreciate all the effort you put into capturing the key points, and then the discussion with Dr. Joseph on your book. I'm sure you probably provide the details on the chat if the audience wants to know more about your book. This is not the slide I want. Yeah, I just want to finish up with this slide because I think this kind of brings it all back from where we started this morning. As many speakers said today, the pandemic has reminded us that we are all interconnected. We are a global village. And climate change, pandemics, natural disasters do not respect national boundaries. So no country is better than another country. We are all connected. We are one global village. That's very clear. The second thing is, unfortunately, the inequities in society seem to be getting worse. And we've talked about almost 2/3 of the world's population being in rural areas with limited access. The third thing I think we also need to recognize is that we cannot take urban development models and apply them to the rural areas. because our consumptive lifestyles and types of development models have created many, many risk scenarios, which includes pollution, processed foods, unmanageable waste, contamination of natural resources, chemicals, pesticides, plastics. All of this today, the speakers touched on this. So we need to be very careful in the rural development that we don't repeat those mistakes. But at the end of the day, what we've been trying this ideal in the ideal village concept, which is really a concept to bring it together, is that we want to focus on enabling those essential needs so that all those communities that are lacking those needs have those needs. And we start reducing these massive inequities, which really, there's no excuse for them, given the amount of technology that we have and given the amount of wealth that exists across the world. It has to be done through holistic, sustainable solutions. And then finally, collaboration is absolutely important among all the organizations working on social impact. So I wanted to kind of wrap it up for the day and just remind you all that tomorrow is also a very exciting day. We start at 7:30 again. We have 3 sessions as per the agenda, and we will go on till 12:30 California time. So with that, I'll just pass it back to Sunny for his last word. And thank you all for all the participation today.
Thank you very, very much, Ambassador Kapoor, for your really concise summary, and to Sundar for his conceptualization. I just want to thank all of the speakers for today. We had such luminary and well-informed speakers, and they are, through their vision, they are, highlighting the path forward, which is what all this this entire conference is about. They have really outlined the solutions that the world needs to gravitate towards and implement in multiple different arenas. I also want to thank our session chairs. They have done a yeoman's job in helping manage the speakers and marshaling all the resources and getting extremely informative and impactful sessions presented to us. And last but not least, I want to recognize all of our volunteers who have been behind the scenes, running this conference, providing all the visuals and sequencing and things like that, but also the volunteers who helped make the website, designed all the posters and the emails, all the marketing materials, and everything. That they have been literally the backbone of what this conference can present to you and to the world. And then final, but not least, I want to thank all of our attendees from so many different countries. I know there are quite a few attendees still logged in from India, even though it is past 1 a.m. over there. And this just shows their commitment and their enthusiasm and their ability to learn from all of these presentations. And finally, our partners in this conference, who, as was shown on the previous slide, are the Wheels Global Foundation, the IEEE Smart Village, IEEE Smart Village Program, the Tata Consultancy Services, as well as the African Asian Rural Development Organization. And I really appreciate the facility that Stanford University allows us to put up this conference every year. Thank you all for your attention and for your participation. We will see you tomorrow at 7:30 sharp.